What was the other? That was it?
Honourable Member Dr. Cummings.
Thank you, Mr. Chair. Two questions to Honourable Minister. Is there a policy that persons should be on the fixed system? You're trying to encourage persons to be on the fixed establishment rather than the contracted persons, contracted employees. Is there a policy, or the policy has been abandoned? And secondly, later down in the other in the project code and the capital, you've made mention, even in your speech, of the regional hospitals in Tushen and others. So these are new ones you'll be setting up. So will the staff come from here or from the regions? Will you have staff coming from here? But these are new ones, new areas. So where will you have the staff to furnish these other areas, these new areas?
Honourable Minister.
Thank you very much, Mr. Chairman. The ministry now has a policy where persons can choose whether to be on the fixed establishment or to be a contracted employee. That option has been given to everyone, and there are persons who have opted to come off from the fixed establishment and become contracted employee. And you have the vice versa. So we have given people that option. I think for some categories of persons, they prefer to be on the contracted establishment, and that is because they can get every 6 months a gratuity of 22.5%. So it's optional, and people have that choice, and we have been facilitating that. In terms of how we are preparing the new infrastructure that we are bringing in place and the staffing when those hospitals come online, we have already started working on where we are going to be accessing doctors, nurses, and other persons that would be required, but it's not under this heading. As you would appreciate, we'll have to increase training for these categories of persons, and also in the interim, one of the things that we'll be looking at is to get assistance from some of our traditional partners like Cuba, where we have been bringing in medical specialists to work to fill some of the gaps that we have. So we will be working with partners to make sure that we can have these hospitals, when they're up and running, suitably staffed. In addition to that, we do have a lot of persons who are the GPHC, and while they've been trained, the requirement is that some of these persons should be deployed to regional hospitals. And so we are also in the process of making sure that persons who have completed their training would now be able to go out to these regional hospitals to give service in the specialized areas.
Honourable Member Dr. Cummings.
Thank you very much, Mr. Chair. 6224, print and non-print. I notice there's an increase of approximately 3 million in this COVID environment where you have more virtual presentations, and so why would you have an increase in print and non-print?
Honourable Minister.
Thank you, Mr. Chair. I think the increase is a very modest increase. It's just about $2.2 million. But the breakdown under this line item, Mr. Chairman, we have allocated $1.2 million to the CMO's office for various things. CMO, the Minister's office, the PS office, the Chief Nursing Officer, for various things like letterheads and memo pads and so forth. Then there's a $5.8 million that would go to print requisition vouchers, and also to print the forms that are required for the logistic management information system. There's a $4.9 million that have been allocated to transport forms. These are forms that people need to fill up when they travel and so forth. and some other types of documentation that is required. There's a 0.88 million that is for equipment loan forms. So if a department borrows another piece of equipment from some other department, they have to fill up these forms. So there are special forms that are available for that. We have to print them. There's a $1.3 million that is allocated to printing things like payroll slips, payment for traveling and revenue subsistence voucher and things like that. Another $2.5 million for forms relating to things like environment, annual budgets, and then there's a 2.3 that is allocated for the payment of VAT.
Thank you, Minister. Honorable Member Dr. Cummings.
Thank you, Mr. Chair. Under other, 6294, what constitutes other here? Could you explain and let us know?
Honorable Minister.
Thank you, Mr. Chairman. This one, actually, we have a big increase here. So we got a $399 million increase under this heading. So we now have $863 million to be used under this heading. What we are doing here, Mr. Chairman, is this is the program where we provide assistance to patients who need such assistance. So this year, we have projected spending $400 million for patients who need cardiac interventions. We have projected to spend $60 million for persons who need CAT scans and MRIs. And under this heading, we have projected $180 million to give dialysis patients $600,000 per annum. We have also put under this heading another $70 million to assist persons who need radiation. So there are people who would need like brachytherapy and other forms of radiation therapy. We have allocated $18 million here for cross-matching. These are patients who are going to get renal transplants, but to do so, we need to cross-match them to make sure that they're compatible with the donor. And so we have allocated $18 million for that. We have allocated $20 million here for eye care patients, people who would need specialized operations of the eye. We have also allocated here $12 million for patients who would need prosthetics, so whether they need a hand or a foot. So we have an allocation here for those patients. And there's another $103 million for patients who would need help for other illnesses. And these are mainly patients that we will send overseas. Mr. Chairman, under this heading has been very beneficial to a lot of people. And in 2021, we were able to help with the allocations that we were given, 1,538 persons. And this amount is expected to grow during this year.
Thank you very much, Honorable Minister. Honorable Member Dr. Cummings.
Thank you very much for that information. It's commendable, and I'm happy that you want to increase it as persons. There are still people who are vulnerable and poor. Last question under this section on subsidies and contributions to local organizations. I've noticed that the President's Commission on Non-Communicable Diseases, it comes under this subvention comes under this section on policy development and administration. Since you develop a new um, section or area number 8, the 8th section on non-communicable disease by itself, would you not want to put the President's Commission under that section, or you let it remain under policy development in terms of subsidies?
Honorable Minister.
Thank you very much, Mr. Chairman. Indeed, we have allocated about $8.2 million to the Presidential Commission on Non-Communicable Diseases. This commission is a broad-based commission where you have stakeholders from different segments of society. And we have done that because of the importance of chronic non-communicable disease. It is not a health problem, it is a societal problem. And therefore, we need to have this broad-based consultation and getting people involved in understanding these types of diseases and what we need to do to prevent them, and if people get them, how to treat them. So the Commission helps in many ways to set policy, they tender advice, and that's why they're still, they're getting this kind of subvention from us. And indeed, you are correct that we have created, as of last year, a new program, which is the 8th program in the ministry, because of the importance of chronic non-communicable diseases. And we are going to work to expand that program, and over the next couple of years, you would see different items that would appear there that would focus more on chronic non-communicable disease. And at that point, maybe we will see whether it might be most appropriately placed under that particular heading.
Thank you very much, Honorable Minister. Honorable Member Dr. Cummings.
I just want to remind the Minister that, the AP and UAFC would have resuscitated that program. Thank you.
Thank you very much, Honorable Minister. Honorable members, I now put a question that the sum stated for Agency 47, Ministry of Health, Program 471, Policy Development and Administration, current expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, we can turn to page 662. And I propose a question that the sum stated for agencies 47, Ministry of Health, Program 471, Policy Development and Administration, current expenditure stands part of the estimates. Honorable Member Dr. Cummings.
Thank you, Mr. Chair. Honorable Minister, 121-6200 buildings. I know it's a new building, just obliquely opposite your office. Is it going to be completed this year? This 273,168,000, is it enough to complete it? So give us the due date, the due date if there is a date, and if this will be adequate, and what else needs to be done.
Thank you. Before you go, Honorable Minister, I did leave out it's the capital expenditure under that head we're putting. Honorable Minister, go ahead.
Thank you, Mr. Chairman. Thank you, Honorable Member. As you know, this has been a long-standing project, and I think it would have gone over budget. And as you rightly said in the last program that we dealt with under the current program that we just dealt with, this was one of the APNU AFC's project. But it went beyond the budget, and we are now trying to fix it and to correct some of the defects that were there. You would also recall that last year we had to terminate the contractor that was on the job because they weren't fulfilling their contractual mandate. So we have fixed those problems, and now we have an allocation of $259 million to complete this project during this year. We expect that by mid of this year, it should be completed. Right now, it's on schedule based on the timelines that we have set with the contractor. And there's another $13 million that have been allocated for the supervising form to make sure that this project is completed on time.
Thank you, Minister. Honorable members, I now put a question that the sum stated for Agency 47, Ministry of Health, Program 471, Policy Development and Administration, Capital Expenditure, stands part of the estimates. Those in favor say aye. Those against say no. The ayes have it. The sum stated now stands part of the estimates. Honorable members, let us turn to pages 356 and 357. Honorable members, I'm trying to get, it seems to be, I might have been the victim of the Mahi-Paul syndrome. Sorry, 356, 357. 356, 357. Honorable members, I now put a question that the sum stated for Agency 47, Ministry of Health, Program 472, Disease Control, Communicable Disease, current expenditure stands part of the estimates. Dr. Cummings.
Thank you, Mr. Chair. 6284, on the other, there's a decrease from 27,936,000 to 42,336,000. What's the reason for that increase, and what constitutes this line item?
Honorable Minister.
Thank you, Mr. Chairman. Thank you, Honorable Member. There is an increase of $14 million, approximately 14.4. And that's because we have, under this heading, absorbed a number of cleaners that we have at the Infectious Disease Hospital at Ocean View, so that we can provide cleaning services there. So that $14.4 million increase would be used for cleaning services at the Ocean View Hospital.
Thank you, Honorable Minister. Honorable Member Dr. Cummings.
6221, drugs and medical supply. I noticed there is a decrease in this amount from 7 billion to 4 billion. Could the Honorable Member give us, Honorable Minister, tell us why the decrease, since it's communicable disease and COVID hospital, I think, comes under this, the aegis of this the program. So what's the reason for the decrease in drug and medical supplies?
Honorable Minister.
Thank you very much, Mr. Chairman. Uh, the increase here, or the decrease rather, it's because if you go back and look at the original budget for last year, you would see that the budgeted sum is about $3.9 billion. And that what you actually have here of 4.1 is actually an increase over that budgeted sum. The reason why it is showing here as 7.1 billion, you'll recall we came to this house to ask for supplementary, and that supplementary is included in this actual amount. So the 4.1 that we currently have in the 2022 budget is going to be adequate for the meds and supplies that we need to buy for this year.
Thank you, Honorable Minister. Honorable Member Dr. Cummings.
Just for my curiosity, but I noticed that you have supplies also in capital. So you're straddling both current and capital. You know, we haven't reached capitals yet, but I noticed that you made an arrangement to have more money for the COVID hospital on the capital. So I guess you'll tell me what are the things that you would purchase under this line item. All right. So when you finish, I have another question.
Honorable Minister.
Thank you very much, Mr. Chairman. Under this heading and throughout the different programs, you would see it occurring as medicines and medical supplies. In some cases, we can divide that, or we can put some part of it to buy things like reagents, which would be considered to be medical supplies. For this particular heading, the things that we're buying here, for the 4.19 billion, this includes an allocation of approximately 1.1 billion that would be going to the Ocean View Hospital. And this is for the things that we need for the patients who are going to be admitted there, things like oxygen and medicines and PPEs and everything else that is needed over there. We also made an allocation of $931 million, and include this is going to NAPS, National AIDS Program Secretariat. And in this particular program, we are switching out some of the older ARVs that we were using. And we have a new algorithm that we'll be using now for our patients. And this involves newer drugs, and they're a little bit more costly. So we have allocated here $931 million for that particular expenditure. We have also allocated $776 million for laboratories, the National Public Health Reference Lab. And as you can imagine, a substantial part of this is going to go to buy the reagents needed for PCR testing. We have also allocated $523 million for the Health Emergency Operating Center. This is the coordinating unit for the COVID response. And we have allocated another $328 million for the development of a malaria laboratory and a number of things relating to malaria and some of the other neglected infections. There's a $208 million that has been allocated to TB. There's a $173 million that have been allocated to Hansen disease elimination. We have a $69 million for filaria and leishmaniasis drugs. Filaria, while we have done the mass drug administration, we have to now do the validations. So we are in that process. We have PAHO WHO that is coming in to do the validation. So that's why there's an allocation there to do those validation exercises. We've also allocated $30 million for medicines for dengue and $16 million for veterinary public health, and a small sum of less than $1 million for port health. Port health.
Thank you, Honorable Minister. Honorable Member Dr. Cummings.
Yes, thank you for that comprehensive breakdown. But I haven't seen the pills, the new pills, if you thought that's the way you want to go. I think I heard you mention that for COVID. Plaxovid and the new drugs. Was it included in here? And
Honorable Minister.
So the sum that we have allocated, thank you, Mr. Chair, the sum that we have allocated for the COVID infectious disease hospital would include not just oxygen, but things like the medication that we're using there. Currently, we are using remdesivir and we're using baricitinib. Our intention is to procure Paxlovid once it becomes available on the market. Unfortunately, the supply is quite limited, and a lot of that is being used in the United States and some of the European countries. So access to it is quite limited. We have also been trying to source the marked drug molnupiravir, and we have made some headways with that. And recently, about a week ago or 2 weeks ago, a local company has registered molnupiravir in Guyana, and hopefully they'll be able to supply that particular drug. So once these things become available, we'll try to source them for our patients, and we have been monitoring to see how we can get access to them. In addition to that, we have set aside, not under this program, not here, but we have set aside adequate resources to make sure that we can buy the vaccines when we can get access to the 11 to 5 vaccines.
Thank you, Minister. Honorable Member Dr. Cummings.
yeah, before I leave this program, I just want to ask you, going back to the COVID hospital, the person, the owner, the owner is the word, have you paid off the owner for the building, the COVID hospital purchase? So you bring us up to speed on what's happening with that institution in terms of the
Honorable Minister.
arrangement there.
Thank you very much, Mr. Chairman. Thank you very much, Honorable Member. I think those matters are best dealt with the AG chambers. And under this heading, we are not catering for any such payments. We are dealing with current expenditures.
Thank you very much. Honorable members, I now put a question that the sum stated.
Mr. Chair.
So, Honorable Member Mr. Figueroa.
Thank you, sir. 6302 trillion, Minister, seeing an allocation here, $67+ million. Could you indicate what type of training will be offered and how much persons are likely to benefit from this opportunity being provided?
Honorable Minister.
Thank you very much, Chairman. Thank you very much for the question, Honorable Member. We will be spending $67.9 million on various types of training. All of these trainings would be done in-house, meaning by various departments of the ministry. And so we have allocated $15.5 million to the National AIDS Program Secretariat to conduct training. As I've just explained to the Honorable Member, Dr. Cummings, we are changing our ARV, the antiretrovirals that we're using. We're changing the algorithms that we're using, and this would require that we train the doctors to use the new algorithm. In addition to that, we are also training persons to do PrEP. That's pre-exposure prophylaxis. This is the new way of preventing HIV infections. And so we want to make sure that most of our primary care doctors are able to do PrEP. and also PEP. So if somebody has been exposed to HIV, that they can get treatment readily. So some of the things that are in here for NAPS, these are the types of training that we'll be doing. Including in that training also, we'll be rolling out, we've started rolling out what is called self-testing. So if somebody believes that they're HIV positive, instead of coming to one of the clinics to get tested, they can get a home kit and test themselves at home. So again, the people who would be making these kits available and then talking to some of these patients, having tested to come into the clinic, we have to be able to train them to explain to people how to use these kits. So that's NAPS, that's $15.5 million. We also have $9.2 million allocated for malaria. And again, there are a couple of things that we're doing here. One is that we have to train people how to read the malaria slides. So we normally would go on a round of training every year to the areas where we have the most malaria. So that's Region 1, Region 7, Region 8, Region 9. There are parts of 10 as well where we've seen malaria cases. So we train people how to do microscopy, and we have a protocol of how that training is done. This year also we'll be rolling out rapid diagnostic tests for malaria. We have bought 100,000 of those kits, and we'll be distributing them to the different areas. And again, we'll have to teach people how to do these things. So that's malaria. We have also set aside $6.6 million for epidemiology. This is training people how to track diseases and understand the dynamics of diseases. So again, a lot of the people that we have in the field, we have to teach them the kind of data and the type of information that they need to collect and how to send that information, clean it, and then send it up to the central unit. We have set aside $5.9 million to train healthcare workers on the diagnostics of, on diagnosing and treating dengue, because this still remains a burden in our country. We have set aside $5.3 million for surveillance, especially surveillance dealing with COVID-19. And again, this is in all the regions of the country. TB, we have set aside $4.8 million for TB training. And one of the challenges that we do have with TB is non-compliance of some of the patients, because they have to be on meds sometimes more than a year. And because of that, people are not compliant. So in this line item, we are training DOTS workers. These are people who would go out in the field and directly observe that the people are taking their meds. Plus, we have set aside monies here to look for drug resistance patients that would exhibit drug resistance. So that's important, because if we have too many of these patients, then we can have challenges with the meds that are currently available globally. So we have to monitor for drug resistance. We also have $4.4 million for filaria. But while we have a very robust program and we hope that we have eliminated that, we still have to do the training to check to make sure that we have, in fact, eliminated filaria from Guyana. We have another $3.9 million set aside for entomology training. So this has to do with the types of mosquitoes that we have in Guyana, to look for the different types, to determine their breeding patterns, the way that they can infect people and so forth. And so this money would be spent in this direction. We have a number of programs that we've introduced last year. We started a program where we are sterilizing the insects and then releasing them back into the population. And by doing that, what that would do is to collapse the population, meaning that you have fewer mosquitoes. This is a collaboration that we have with the International Atomic Energy Agency, and we have started that pilot last year. We're going to continue this year. We have another $3.4 million for Port Health. Again, people coming into the country, we need to screen them. We need to make sure that we are tracking them and collecting that information and tabulating that information. So we have set aside monies for that. So this basically is some of the things that the types of training that we'll be doing, inclusive of some training that we'll be having both for veterinary public health, because we have to inspect all the meat and fish and everything that this country exports. And we have $1.5 million for the National Public Health Reference Lab. So this is updating people's skills at the reference lab.
Honorable Member Dr. Cummings. Honorable members, I now put a question that the sum stated for Agency 47, Ministry of Health, Program 472, Disease Control, Communicable Disease, Current Expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, to page 662, please. And I propose a question that the sum stated for Agency 47, Ministry of Health, Program 472, Disease Control, Communicable Disease, Capital Expenditure, stands part of the estimates. The Honorable Member, Dr. Cummings.
Yes, I'll be asking two questions in this area, land and water and the COVID-19 response program. So 2405600, land and water transport, and notice there's a purchase of a vehicle. Could you give us the specs, which, I know this program will be using it, what for? And with it, how many of them? Is it one vehicle?
Honorable Minister.
Thank you, Mr. Chairman. Thank you, Honorable Member. This here is to buy a minibus, and that minibus would be used for the entomology department so that they can go out and do the work, find Aedes mosquitoes or the other types of mosquitoes. So that's what it's going to be used for, and it's a minibus.
Thank you, Minister. Honorable Member Dr. Cummings.
440520, COVID response program, provision for COVID response initiatives. What are some of the projected response under this capital project?
Honorable Minister.
Thank you, Mr. Chairman. This allocation is for $1.1 billion, or $1 billion. And the first thing that we have here is an allocation of $121 million to do some additional works at the COVID hospital or the Ocean View Hospital. Those works that we have done would include the establishment of an operation or surgical theater. And that is because some of the COVID-19 patients that we do have from time to time would have surgical emergencies. So rather than have them there and they have a surgical emergency and then we have to move them to Georgetown Hospital to be able to operate there, what we're doing is establishing a surgical theater there that can be used for a wide range of surgical interventions. So that's, we'll be spending some money doing that. We have also been working to make sure that every one of the beds that we have there, they have piped oxygen instead of having the bottles next to the bed. And we started that project last year. This year we are going to complete it. and that would cater for the 195 beds that we have there, each one of them receiving piped oxygen. We have also set aside some monies to build a base for the oxygen plant. We have had a donation of an oxygen plant. Unfortunately, it has not arrived as yet because we are having challenges with the shipment of the plant coming to Guyana. This has been a donation from one of the humanitarian organizations. They have the plant, they have packaged it, and it's going to come to Guyana, but it was delayed because of the difficulties you're having with global shipment. Now, in addition to that, we have a number of equipment that we would be buying for the hospital. This includes things like for the surgical theater, anesthetic machine. We needed some additional refrigerators and so there's a whole host of equipment that we need to buy, and that is included here, including cardiac monitors, delivery beds. We're buying a dialysis machine because, again, from time to time, we do have patients that come into the hospital that requires dialysis. Right now, we are providing dialysis services to those patients, but we are renting the machine. So this year, we are making an allocation to buy the machine so that we can have that service continue. There's a whole long list here. I can go through them if you want, but that's what the money would be spent on.
Thank you, Honorable Minister. Honorable Member, Ms. Sarabo Ali.
Thank you, Mr. Chair. The Honorable Minister indicated a lot of what they're doing on the same program 4405200 in terms of COVID-19 response. What I noted was that most of it had to do with the hospital. So I would like to honor Minister if any of this would be going to preventative measures as opposed to when somebody ends up in the hospital.
Honorable Minister.
Thank you, Mr. Chair. Indeed, the honorable member is correct. Most of this allocation is going to go to the infectious disease hospital. But we have other sections of the budget where we are spending monies to acquire PPEs and other things that are necessary for prevention. So it is not under this heading, but we do have those allocations to make sure that we have enough PPEs and other things that are required for prevention.
Thank you, Minister. Honorable members, I will now put a question that the sum stated for Agency 47, Ministry of Health, Program 472, Disease Control, Communicable Disease Capital Expenditure, stands part of the estimates. Those in favor say aye. Those against say no. The ayes have it. Sum stated now stands part of the estimates. Honorable members, I now turn to page 358 and 359. And I propose a question that the sum stated for Agency 473, Family and Primary Healthcare Services, propose that again. Honorable members, I now propose a question that the sum stated for Agency 47, Ministry of Health, Program 473, Family and Primary Healthcare Services, current expenditure stands part of the estimates. Honorable Member Dr. Cummings.
Thank you, Mr. Chair. 6116 contracted employees. What we have been seeing previously is a decrease in this area, but here we have seen a decrease from 10 to 131. In terms of the allocation, 48,481,000 to 203. So this is really remarkable. 10 employees in 2021, now 131. Very interesting. Could the minister shed some light on this massive increase? you know, and the top five persons who in this category and the emoluments.
Honorable Minister.
Thank you, Mr. Chairman. Thank you very much, honorable member. The persons who we have under this category is really those persons that we have recruited to assist us with COVID-19 vaccination. So they include about 44 clerical staff and 55 nurses that we have hired to be able to do the vaccination program. And they have some other categories of people that we have brought on here. So that accounts for that big increase that you have seen under that line item.
Thank you, Minister. Honorable Member Dr. Cummings.
Other transport and travel and post is 6265. Moving from the allocation, moving from 32, almost 33 million to 60 million. Could you shed some light on this increase in this category?
Honorable Minister.
Thank you, Mr. Chair. We have allocated here $60 million. And again, as the honorable member would appreciate, we have to continue our COVID-19 vaccination program. So this caters for the transport of vaccines. We'll be spending at least $20 million in air freights, sending them to the different regions. We also have to hire buses to be able to take staff and vaccines out to different locations, especially when we try to, outside of the regular health centers, we go into some of the areas, the villages and so forth. So we need to hire extra transportation. And that, we have set a notional sum of about $22 million to do that. And we also have to transport some of the refrigerators that we have bought. Because remember, in some cases, the vaccines that we are using require -20. And we have bought some of those refrigerators. We are buying some more this year. And we are putting them strategically in different regions. So to move those refrigerators, it's quite costly because some of these things you can't fly them in because of the chemicals that they have. So we have to take them overland. So we have allocated $18 million to make sure that we can send in these refrigerators.
Thank you, Minister. Honorable Member Dr. Cummings.
Mr. Chair, thank you. I've noticed from a single digit 6 million, this has gone to almost 10 times. It's 57,483,000. What constitutes other in this category and this line item? 6294.
Honorable Minister.
Thank you, Mr. Chairman. Under this line item, we've had a substantial increase because we'll be spending $50 million approximately in collaboration with the First Lady's menstrual hygiene project. So this is where young girls who need menstrual hygiene products would be able to access such products. So rather than have it as an ad hoc program, we have included it so that we can budget for it and make sure that persons who require these types of services would be able to get the services.
Thank you, honorable members. I now put the question. Honorable Member Mr. Figueroa? No?
Yes, thanks.
6291, national and other events, $25 million there. Could you say under this line item, what is the national events we'll be catering for?
Honorable Minister.
Thank you, Mr. Chairman. I think I want to thank the honorable members. What we do here really is we have in health, we have certain health days that we want to raise awareness. So some of those include spending on vaccination week. So we have an expanded program of immunization. And during that week, we do a lot of awareness. So we'll be spending about $12.8 million on that. We want to make women more aware of the maternal and child health services that we have. We'll be spending about $1 million on that. Under the food policy division of the ministry, we want to encourage people to eat the right things. So we have about a $2 million expenditure where we'll go out, we do things like cookouts to show people how to cook in the right manner and so forth. Environmental health, we have an allocation there where they would be spending about $700,000 to highlight the importance of some of the environmental issues that we want people to understand. Adolescent health, under this heading, we'll be working with young people to make sure that some of the key issues, things like teenage pregnancy and so forth, that they can get a handle on some of those issues. So we'll be spending $2.1 million on that. Men's health, again, I spoke briefly on the issue of prostate cancer being a problem, the #1 cancer amongst men. And men generally don't like to come to see a doctor. So we want to encourage more men to be able to come and get regular medical checkups. And also, so this sum of money here would help us to do some of that kind of highlighting and raising awareness. We also have set aside $1 million for the elderly. And again, they have specific times during the year when we will do those types of activities for the elderly. And we have an allocation of $3.2 million to promote women's health. So this is how the sums of money allocated here would be spent.
Follow up.
Honorable Member.
Thank you, Comrade Chair. Listening to your explanation, Honorable Minister, I think it's a good initiative, but I wonder if the allocation is sufficient. Because if we are to do this program throughout Guyana, $2 million to bring awareness to, for example, the prostate cancer that you just spoke of, is this indeed sufficient? Or is it just going to be centralized, or is it the intent for it to be disseminated in the other regions? And while I'm on the floor, if I could add, so you could just answer both questions. The 6302 training, could you give some indication of what is the training that will be done under this line item, and how many persons it is likely to provide the opportunity to be trained?
Honorable Minister.
Thank you, Mr. Chairman. The member actually asked a very valid question, but you would also appreciate that in this year's budget, we are getting $25 million, which is an increase. It's almost double. So last year it was 12 million, now we're getting 25. And I think as we expand these programs and we go out to different communities, we would increase these allocations. What we tend to do is that when the staff of the ministry is going out, they go as teams so we can piggyback and do different things at the same time. And that's how we intend to spend this money. And we are also, with the types of training that we are doing, we want to make almost every health facility, whether health post or health center, an area where a lot of this type of health promotion can happen. So when you come in, apart from coming for services, the staff there must be able to explain some of these things to people in a way that they can understand and also to help them to take action. So that's the intention. In terms of the training, so under this heading, we have allocated $90 million for training. Again, a lot of this is going to be in-house types of training that would be done. We have $49 million for maternal and child health, expanded program of immunization. We do about 19 antigens for children, meaning vaccinations that we give to children. And every year we have to train people and upgrade their skills and so forth. So that's what this money is going to be used for. In addition to that, we have a section in the ministry that deals with dental health, and we have allocated $7 million to train different categories of health workers to promote dental health. So apart from the dentexes and the dentists and so forth that we have, again, we are trying to introduce some of these programs at the health center and the health post level so that they can also help us with the promotion. Food policy, we'll be doing training. Food policy will be going out to do training. There's an allocation of $9 million for them. Adolescent health, we have $6.9 million. Environmental health, $5 million allocation. Women's health, $5 million. Men's health, $3.1 million. Health promotion, $2.3 million. Health of the elderly, $2 million. So these are sums that have been allocated, and the training varies. So that's what this heading would be used for.
Thank you very much, Honorable Minister. Honorable members, this is a good time to put the question that the sum stated for Agency 47, Ministry of Health, Program 473, Family and Primary Health Care Services, current expenditure stands part of the estimates. Those in favor say aye. Those against say no. The ayes have it. The sum stated now stands part of the estimates. Honorable members, we can turn to page 662. And I propose a question that the sum stated for agency number 47, Ministry of Health, Program 473, Family and Primary Health Care Services, capital expenditure stands part of the estimates. The Honorable Member Dr. Cummings.
Thank you, Mr. Chair. Project code 4403200, maternal child health improvement. I've seen 446,660,000 here for provision for equipment for IDB. Could you state what this equipment is? If it's for, contraceptive, intervene, what could you explain and state what this project entails?
Honorable Minister.
Thank you, Mr. Chairman. Thank you, Honorable Member. As you know, this is a program funded by the IDB. And under this program, we're working in regions 3, 9, and 4, regions 3, 4, and 9. And part of this program is that at the health centers to make sure that they have enough equipment to be able to deliver the services, a higher quality of service. So this allocation is to make sure that we procure those equipment and make it available to the health centers. So it ranged from things like boards, scales, and all these things that are required at these health centers.
Thank you very much, Honorable Minister. Honorable Member Dr. Cummings.
I just want to ask the doctor if, honorable member, if the contraceptive, the last use, the one that people were trained from even from other countries, in terms of the contraceptive use, if that's still on board?
Honorable Minister.
We are continuing that program to make sure that people can understand more about contraceptives and so forth. It's not under this heading. I think we have passed it, but we have allocated $154 million to procure contraceptives and different types. So that we're making sure that we have an adequate amounts of money to be able to provide that service.
Thank you, Minister. Honorable members, I now put a question that the sum stated for Agency 47, Ministry of Health, Program 473, Family and Primary Health Care Services, capital expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it, the sum stated now stands part of the estimates. Honorable members, we can turn to pages 360 and 361. And I propose the question that the sum stated for Agency 47, Ministry of Health, Program 474, Regional and Clinical Services current expenditure stands part of the estimates. Honorable Member Dr. Cummings.
Here again, contracted employees moving from 537 to 642, 6116 line item. And I noticed there's a decrease. So could you explain the inverse relationship here?
Honorable Minister.
Thank you very much, Mr. Chairman. In fact, there is an increase in contracted employees. If I can ask the honorable member to go to a paper that was circulated yesterday. So in that paper, you would see there's a correction because I think when the information was submitted to the Ministry of Finance, we were asked in August to submit the information relating to staffing, and then it was supposed to be updated in December. And I think there was, instead of using the more current figure, inadvertently, the August numbers were used. So that's why yesterday a correction was circulated. And if you go to the contracted employees, what you would notice is that in 2021, we had 537, and that has now increased to 610.
Thank you, Honorable Minister. Honorable Member, Ms. Ali.
Thank you, Mr. Chair. 6321, subsidies and contributions to local organizations. I see there is $13 billion that I believe goes to the Georgetown Public Hospital. I know it is an increase, but given all that has happened over the last year and the intention, I believe, of the minister to develop health in this particular arena, and the fact that yet we still need to have, we're still looking at more regional hospitals elsewhere, and that most of the country goes to Georgetown Public Hospital, whether this increase is sufficient for everything that the Georgetown Public Hospital has to do and should be increasing over, in this particular year.
Honorable Minister.
Thank you very much, Mr. Chair. Thank you very much, Honorable Member, for that question. This shows an increase of about $1.7 billion from last year to now. And based on the work that we want to do at the hospital, I think this is adequate. In addition to that, as we improve the services at our regional hospitals, we would be able to decant some of the services that people would normally come for at the Georgetown Hospital. So we are hoping that less persons would come to the Georgetown Hospital, and we'll be able to provide the service in the regional hospitals. More and more, we are repurposing Georgetown Hospital to be able to do more specialized kinds of services. And last year, as you would recall, the Festival City Polyclinic came into operation. And this year, we have allocated additional sums of money to make sure that the polyclinic is fully functional. That would include having diagnostic capability, laboratory capability, dental capability, and so forth. And it would be able to house approximately 14 doctors, along with about 2 dentists. Now, in a big way, that is going to take a lot of the outpatients that currently come to the Georgetown Hospital. They would be able to access service closer to where they live. So that's the whole purpose. A lot of these things that we're doing now is that those non-urgent persons would be able to access services closer to where they're living.
Thank you, Minister. Honorable Member Dr. Cummings.
Yeah, through the chair, I hope ophthalmology is also included in that list. Because that's non-urgent and, you know, unless it's a surgery being done, that's being done. 6284, I've noticed there's an increase from 111 million to 125 million here. 6284, and it constitutes other. What are some of the constituents of this line item?
Honorable Minister.
Thank you very much, Mr. Chairman. I'm sure that the Georgetown Hospital would make the relevant arrangements so that ophthalmology can be provided. I don't think that's much of a difficulty. In terms of this particular heading of 6284, we have an increase of $14 million. So the actual sum that has been allocated is $125.5 million. We will be using $120 million for the Cuban Medical Brigade. As you know, we have a large contingent of Cuban doctors and nurses and physiotherapists that are currently here. In fact, I think we have close to 80 doctors and nurses who are working, and physiotherapists who are working at the infectious disease hospital. So this sum of money would be going to making sure that we are able to bring them, take them back, and all the allowances and so forth that we have to pay. In addition to that, we have allocated $2.6 million to Linden Hospital Complex and $2 million to Cookwanee. And this is for various expenditures that they would incur at these hospitals.
Thank you very much. Honorable Member Ms. Halley.
Thank you, Mr. Chair. The same line item, 6321, I'm looking at the Appendix D that deals with the Georgetown Public Hospital, and it says here that employment cost is $7 billion. I'm not questioning that at all, but I was just wondering whether the minister could indicate the doctor-patient ratio and the nurse-patient ratio to see whether or not the number of staff employed is adequate, or they intend to increase the staff at that hospital.
Honorable Minister.
Thank you very much, Mr. Chairman. I don't have the exact numbers with me here. However, I'm told, because of the post-grad programs and so that we have for the doctors, that we do have an adequate complement of doctors. whether they're consultants, registrars, GMOs, we do have an adequate complement. Where I think there's some difficulty is the amount of nurses that we have. And it's not only at the Georgetown Hospital, but we need to look across the system as well. The only place that we have in excess, nurses in excess, is really in the Linden Hospital complex. And so one of the things that we'll be doing is we'll be expanding some of the nursing programs. And in the future years, what we're hoping to do is to have a larger program to be able to train more nurses and also to offer specialized nursing programs. Because as you recognize, in some of the departments, it's not just about having regular nursing, but you need to have the specialization. And so some of these changes we'll be able to do. Right now, for a nurse to actually get upward mobility, they have to complete midwifery training. And sometimes if they're not in that field, why is it necessary that they must complete that for them to get upward mobility? So some of these pathways, we are working on changing them, and hopefully we'll be able to do some of that by the end of the year. We also have an additional problem, and that is their active recruitment of nurses from Guyana. And we have been losing nurses because of this active recruitment. So we are looking at various ways that we can slow that down. I don't think we might be able to ever stop it, but we at least have to slow it down and then be able to produce more nurses for the facilities and so forth that we need.
Thank you, Minister. Honourable members, I now put a question that the sum stated for agency.
Mr. Chair.
Honourable Member Ms. Halley.
Thank you, sir. I think, through you, Chair, the Honourable Minister almost preempted my next question. In terms of the nurses, as you did highlight, we're losing nurses. And the reality is that we train for not only Guyana, but for the region and for the world at large. So my question to you then is, what exactly the systems that you plan on putting in place to ensure our nurses feel comfortable enough to stay and not leave the shores?
Honourable Minister.
Thank you very much, Mr. Chairman. There are many things that can be put in place. So first of all, if we look at how many nurses we are able to graduate, that number is relatively small. So in terms of training more people to fill the gaps that we have, that is something that we will be addressing. And then, of course, we have to address retention. That's a much bigger problem, and that is to compete with the salaries that are being paid in the UK. That's a very tall order. And what is happening right now is that when a nurse is offered a job, let's say in the UK, that offer is not just for the nurse to go to the UK, but for the entire family to accompany the nurse. And so these are the dynamics that we have, and we'll have to work to see how we can slow it down or address it. But it is a big challenge. That pull factor is a big challenge. So we are working on it. I wouldn't say that we have perfect solutions, but we have to work on addressing some of these things. One study that was done many years in the ministry was to provide, when nurses were interviewed and asked what would be some of the non-monetary incentives that they would like to see put in place. There were a list of things that came up, including for the Georgetown Hospital to set up a daycare, because many of the nurses, they have small kids and they want to have a place where when they have a break, they can go and see the child and so forth. So that is something that we are going to work on to make sure that we put in place. I know the hospital had made arrangements to do that. And so this year we are going to work on that. But there are other non-monetary incentives that we can put in place, and we are actively considering some of those incentives. Other than that, as you would know, having served as a Minister of the Public Service, is that to increase salaries, that would require a lot more detail and study to see how that can be done.
Thank you.
Honorable Member Mr. Figueroa.
Thank you, Chair. Follow up on that same nursing issue that you just raised there, Mr. Minister. I would have, I don't know if I'm clear, but I would stand corrected, but I think I heard you said Linden has a lot of nurses. What Linden also has is an exodus of a lot of the nurses with respect to what you just mentioned, going to the UK, over 50-something nurses. So that is an issue that is plaguing the community. So one is the ministry's intention to extend the amount of intakes into the region, because we're not training nurses to serve Region 10, but to serve Guyana. So would that be a consideration to address the exodus of nurses, particularly from our region that has seen the largest exodus of trained nurses?
Honorable Member, Honorable Minister.
Thank you, Mr. Chairman, and thank you very much for that question. The last time I checked, which was maybe about a month or two ago, I think in Linden, we had about 250 more nurses than is required for the services that we provide in Linden. So we have been encouraging some of those nurses, and we do provide some incentives for some of them to come and work with us in other locations. And some of them have done that. So we have been moving some of them around internally, and that is going to continue. So that's one. Two, in terms of increasing the intake, that is something that we are actively looking at. And our intention is over the next few years is to have a much larger intake. We are going to start this year to review the curriculum of nursing. We have a specialized team that is going to come in to work with us on reviewing the curriculum, reorganizing the nursing programs for us. And there are lots of other things that would happen. And hopefully, once we complete that, we will then be able to train many more persons so that we can at least try to fill some of the gaps that are being created with persons migrating. But it's a constant struggle. This didn't start yesterday. This has been around for quite a long time. And we have always been grappling with this problem. So we'll have to figure out how to deal with it. But one way is certainly to increase the amount of nurses that we are currently producing.
My last question.
Thank you very much, Honorable Minister. Honorable Member Mr.
Thank you, Chair.
Figueroa.
Last question on this. So, Minister, I believe you are aware of the conundrum that exists in Linden with respect to the employ of nurses. We have nurses from the Ministry of Health, we have nurses from the RDC. What is your plan to bring all of the nurses under one umbrella? Because some of the nurses have articulated the view that some of the benefits of being a nurse under the Ministry of Health, they're not getting that because they come under the RDC and some from another arm. So we need to address this. Efforts were being put by the previous administration to correct it, but it wasn't finalized. Are you first aware of it? And more so, if you are, what are the plans to bring all of the nurses under one umbrella? And more so, what is the projected time frame in getting this done?
Honorable Minister.
Thank you, Mr. Chairman. That has been a very long-standing problem. And that is because the Linden Hospital, the Wisma Hospital, were once managed by the Bauxite Company. And then when bauxite changed from private hands to government hands, more or less, some of these services were handed over to the Ministry of Health. So the salaries that were paid in the private sector at the time, Mackenzie Hospital or Wisma, and Wisma Hospital, was much higher than what was in the regional health services. But the decision at that time was to pay that higher salary to the people who were working there, because when they were absorbed into the health system, they continued to enjoy that higher salary. And that has been maintained over the years. So indeed, there would be a disparity in terms of those who are employed by the region and those who are in the hospital setting. And that's something we'll have to work to see how we can narrow that gap. It is something that we have looked at, and we'll continue to work on different mechanisms of narrowing that. I can't stand here and give you an answer right now, because I know that there have been several attempts of trying to deal with this issue. I don't think, because that still persists, I don't think anybody would have succeeded as yet. But it's something that we have to work on.
Honorable Member, Mr. Figueroa, before you put the question, Honorable Member, we have just 3 minutes remaining on this line item. Go ahead, Honorable Member.
Lastly, sir, given the fact that all of those nurses, well, a lot of those nurses are trained under the Charles Rose School of Nursing, and when they're finished training, they are disseminated either to the Ministry of Health, the RDC, or the Linden Hospital complex. Now, the government pays for the services of Charles Roses. Then, shouldn't the benefits until the problem is addressed be at least given across the board for all of the nurses, including more specifically risk allowance? Some are getting, some are not getting, and the nurses are of the view that all should get. I myself.
Honorable Minister.
Thank you very much, Mr. Chair. I think when we think about risk allowance, we also have to look at what types of exposure people would have. And if you're working in a community setting, if you're working at a health center or a health post, that risk is far different from if you're working in a hospital setting. And therefore, because of those differences, that is why some nurses probably would enjoy risk allowance in an institutionalized setting versus those that are in a community setting. So that's one of the reasons why there's that difference, and that's not a now story. That has been going on for a long time. And that's the policy of the various governments. So we can review and we can look at how these things can be adjusted, but it would take some time to do those reviews.
Thank you, Honorable Minister.
Finally,
Honorable Member, we have a minute remaining for the agency, actually, not the line item. Go ahead.
I agree with the view that you just made mention of clinics and so forth. But this particular issue, as I indicated earlier, where the conundrum lies, at the hospital in itself, Ministry of Health workers, the hospital nurses, as well as the RDC workers are working in the same space. And that is why the conflict of who getting this and who getting that also arises. But I understand the issue.
Thank you, Honorable Minister.
Thank you, Mr. Chairman. I just want to say to the Honorable Member, look, we are willing to understand the problem and try to work to fix it. I think that's what is important.
Thank you, Honorable Minister. Honorable members, I will now put all of the remaining programs that exist under this agency. So I put a question that for Agency 47, Ministry of Health, programs 474 Regional Services, 475 Health Sciences Education, 476 Standards and Technical Services, 477 Disability and Rehabilitation Services, 478 Disease Control, Non-Communicable Disease, current expenditure, and the capital expenditure for all of these programs stands part of the estimates. Those in favor say aye. Those against say no. The ayes have it. The sum stated for all of these agencies now stands part of the estimates. Honorable members, let the assembly resume. Thank you, honorable members. Honorable members, we have two agencies remaining. Let me apologize to the staff of those agencies who will have to wait some additional time and return with us after lunch. Thank you very much, Honorable Minister, and your staff at the Ministry of Health. Honorable members, we will take a suspension for 58 minutes.
Not one cries, not a blade of grass. So we ain't giving up no mountains, we ain't giving up no tree, we ain't giving up no river that belongs to we. Not one blue sake, not one rice grain, not one courage, not a blade of grass.
Thank you. Honorable members, please be seated. The House will resolve itself into committee. We invite the Honorable Minister of Home Affairs and his staff to join us as we consider the estimates for Agency 57. Honorable members, as the minister gets in place, let us turn to page 392. Honorable members, I propose the question. Sorry, thank you, Honorable Minister Brinley Horatio Ben, Minister of Home Affairs, and his team. Honorable members, I propose a question that the sum stated for Agency 51, Ministry of Home Affairs, Program 511, Policy Development and Administration, current expenditure, stands part of the estimates. Honorable Member, Ms. Geeta Chandan Edmund.
Thank you very much, Mr. Chair. Through you, I refer the Honorable Minister to line item 6116. I noticed that there is an increase of 45 staff. Can the Honorable Minister indicate the number of advisors employed under this line item, their employment benefits, their experience, and can you additionally lay over the designation emoluments of the additional staff?
Honorable Minister.
Thank you, Mr. Chairman and honorable members. The increase in this light item is just 3%, and it relates to staffers, the Secretary of the Firearms and Licensing Board, research officer, utility service workers, data entry clerks, liaison officers, system development officers, personal assistant, confidential secretary, persons for the TIPS unit in this line item. The emoluments related to this line item, there is a ministerial advisor and other persons as contracted employee under this head.
Thank you, Minister. Honorable Member, Ms. Chandler Edmond.
Thank you again, sir. On the staff details, 329 staff is reflected. Underline item 6221, 41.5 million is the revised sum for 2021. 51.1 million is allocated for 2022. Can the Honorable Minister indicate the downtime in terms of days for the 329 staff? The reason I'm asking is that there is a significant increase in this line item. Is it the case that you do not have confidence in the public health sector? Are you sourcing for an entire hospital?
Honorable Minister.
Mr. Chairman, I think the question is somehow misplaced. The only efforts we've made is in respect of COVID, of course, which reflects the 23% increase in drugs and medical supplies. All agencies of the government, all departments, every office had to take stringent measures in respect of the COVID pandemic. This has had no relationship to or fit in the public health system in Guyana. Absolutely not so. So I want to dispel that notion in the first instance. The honorable member may be aware that the ministry itself and its agencies, except I think for the prison, we've had no death of any employee from COVID. And we did have a death of a prisoner, I think, who had certain comorbidities. So I think we could not conflate this line item with the overall public health system in Guyana, which has been an outstanding representative of how public health systems are run in the Caribbean and Latin America.
Thank you, Honorable Minister. Honorable Member, Ms. Chandler Edmond.
Thank you. Honorable Minister, when I ask these questions, it's for clarity. I represent a constituency. I refer to line item 6281, Security Services. Once again, I seek clarity. I notice that there is a reduction from last year, revised sum of 23.8 million, and 11.5 has been allocated for this year. Is this a case where you're retrenching staff? Because I notice you're expanding your structure.
Honorable Minister.
Thank you, Mr. Chairman and honorable member. The reduction, which is significant, is reflected in the fact that the immigration offices at Linden and New Amsterdam are now being serviced by the Guyana Police Force.
Thank you very much, Minister. Honorable Member, Ms. Chandler Edmond.
Chairman, at the risk of repeating myself.
Honorable Member, Ms.
Thank you. At the risk of me not hearing you clearly, I have to ask for clarity. I refer to line items 6294 and 6284. Can the Honorable lay over the disaggregation for the sums allocated in these line items? And I'm asking that the disaggregation be laid over in the interest of time.
Honorable Minister.
Thank you, Mr. Chairman and honorable members. In the interest of clarity for the constituency, not only of the honorable member, I'm going to say what these issues are. They relate to diversion programs in the Juvenile Justice Department, software upgrades, 14.23 million, payment for advertisers of bids for vacancies in the public advisory, 3 million, the normal washing and sanitizing, 500,000 for brokerage services, bank charges, consultancy fees, 7.1 million. Replacement of door locks and replacement of cabinets, 340,000. This increase caters for diversion programs related mostly to the juvenile holding system for young offenders. In relation to 6294, again, relating to the various agencies and departments, operational expenditures for the Juvenile Holding Center, 6 million. Community Policing Group, 75 million. For trafficking in persons, 7.486 million. The Firearm License Board, 360,000. For the Strategic Management Department, 450,000. For the main office and the new opportunity corps, 4.2 million. Payments for officers attached to the core SOCO, 51 million, and their operational expenses. For the forensic lab, 150,000. Stipends for evaluators, 300,000. And stipends for board members. The increase is basically 8% for that line item.
Thank you very much, Honorable Member Ms. Chandler Edmond.
Thank you once again. Honorable Minister, I refer you to line item 6231 that deals with fuel and lubrication. Can you indicate if the relevant officers have been trained in store regulations to ensure that there is segregation of duties for requesting, authorizing, and collecting fuel? And this question is premised on the findings of the Auditor General's report. If yes, when was the last training conducted?
Honorable Minister.
Thank you, Mr. Chairman. The line item refers to fuel and lubricants. It relates to the operational needs for additional vehicles related to the NOC, fuel for generators and other vehicles of the ministry's office, the Juvenile Holding Center, and the Citizen Security Program. In respect of all of these issues, after reviews, the appropriate SOPs and approaches to ensuring the proper use of the fuel and lubricants are being strengthened and put in place. And I might say, if we talk about some of these issues, we still have legacy issues in relation to these issues. There are lots of records of the use of fuels and other materials, spares and other things which are missing from a certain period previous to when we came into office. I don't want to go there at the moment unless provoked, but just let me focus on our line items, and I don't want perhaps to delve into the details and have to take a step backward and let us have a great clarification of where and why we are at this point now in terms of making improvements.
Honorable Member, Ms. Geeta Chandan Edmond.
Thank you. Honorable Minister, your remark in relation to provoke and provocation will have absolutely no impact on me. Good. I refer to line item 6241 that deals with rental of buildings. In 2021, the revised sum is 4.4 million. For 2022, 19.1 has been allocated. Can you explain the increase? Are you renting more buildings? If yes, for what purpose? Or is it the case that there is an increase in rental charges?
Honorable Minister.
Mr. Chairman, the simple answer in respect of the increase of rental in buildings is that we are renting buildings to house the victims of trafficking in persons for the Juvenile Justice Department, in addition to the payment of rentals for senior staffers and immigration support officers in various areas of the country.
Thank you, Minister. Honorable Member, Ms. Chandan Edmond.
Thank you once again, sir. I refer to line item 6112. What is reflected here is that you had 20 staff in 2021. 20 staff is again reflected for 2022. Yet there is an increase in this allocation, 48.4 for 2021, and in 2022, 56.6. Can you explain this increase, please?
Honorable Minister.
Mr. Chairman, I thank the honorable member for interest in this matter. There's a 17% increase, 8.2 million are reflected in that increase. It's as a result of the changes in salary increases for the budget in 2022.
Honorable Member, Ms. Chandan Edmond.
Thank you once again. Minister, I refer you to 6117. Would the same explanation suffice?
Yes, Mr. Chairman, I want to thank the honorable member for that.
That was 6117?
6117. Temporary employees, I could call them out, 2 temporary appointments.
No, I'm looking because my page, unless I'm suffering again from the...
6117.
Yeah, because there actually was a decrease from the actual last year. 6117?
No, there's an increase.
Sorry. Yes, it's an increase.
So, Honorable Minister, I refer you again. I asked if the explanation for 6112 would be the same explanation for 6117, and your answer is yes.
Yes.
It reflects the 7% increase.
Yeah.
Yes, I said it's yes, and there was also an increase in staffers.
Under staffers. Honorable Member, I now put a question that the sum stated for Agency 51, Ministry of Home Affairs, Program 511, Policy Development and Administration, stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members can return to page 666. And I propose a question that the sum stated for Agency 51, Ministry of Home Affairs, Program 511, Policy Development and Administration, Capital Expenditure stands part of the estimates. Honorable Member, Ms. Geeta Chandan Edmond.
Thank you, Mr. Chair. I refer to 1216500 that deals with Citizen Security Strengthening Program. Under the description for this project, it speaks about strengthening capacity, social integration, etc. Can the Honorable Minister indicate the specific sums that has been allocated towards social integration? And what technical staff do you have dealing with this aspect of the program, their qualifications, etc.? And can you lay over the status of the reintegration program? This question is asked against the backdrop that we see several repeat offenders being charged.
Honorable Minister.
Mr. Chairman, I want to thank the honorable member for the interest being shown in this matter. The Citizen Security Strengthening Program has been pursued over a long number of years in respect of having us evolve to a better position in relation to the security in communities, in relation to how we relate with each other. There are a number of outstanding evaluations, reports done in respect not only of general normal coastal communities, but also of indigenous communities, to give us a view on how we can best respond to the social and economic and other issues in those communities, and how we have to intercept, interdict, and create better conditions in relation to security in the communities. The capital total for the citizen security is $475 million. The expertise relates not only to persons who work in the citizen security strengthening program, but also to experts who we hire. Also, I think from the University of Guyana and other consultants who are available in our society in respect of citizen security. And if I could just say, since there was an extensive request, as it were, in respect of what the area does, I could just say we have established recently 20 community action councils. 1,293 youths completed vocational training. Entrepreneurship training geared towards reducing unemployment carried out in targeted communities. 205 youths benefit from that training. 186 youths receive financial grants of $312,750 to start a business each. 20 community needs and asset assessment were completed in all 20 communities. Community members were trained on domestic violence, parenting skills to prevent child maltreatment, and conflict reduction to reduce interpersonal violence were carried out in 20 communities. Mentoring programs were carried out. Rapid impact projects were designed and implemented in the communities. And I could call some of those communities: Reading Hook, Westminster, Klein Poudron, All-by-Song, Charlestown, Sophia, South and North Rhymeville, Alberton and South Commonsburg, Kingston, Laceytown, North Commonsburg, West Rhymeville, La Penitence, Agriculture, MacDoom, Mocha, Providence, Annandale and Dozitnan, Buxton, Friendship and Vigilance, Enmore, Haslington, Bushlock, Kildonan, Nurney, Friendship, Albion, Kilcoy, Fireshun for that cluster, Portland, Port Morant, Rosaltine, Adelphi Village, Canefield, Angois Avenue, Wismar, and Rosignol. In terms of what is required, and this is beyond the efforts of the Ministry of Human Services and the Ministry of Culture, Youth and Sports, and it may appear modest, but they're significant because they're targeted. And what we're doing in respect of the Citizen Security Strengthening Program is that now that we have information, now that we have the research, now that we have data, we're transitioning it into activities where we talk about, as I've said here on the floor before, increasing the peace in Guyana. And the perhaps snide remark about people going back into the prison and so on, actually recidivism in the prisons has been reduced. recidivism in the prisons has been reduced. And it will get better as we move now with the new constructed closing plan, create better conditions, and to create a rehabilitative environment for our prison system.
Thank you very much, Honorable Minister. Honorable Member, Ms. Chandler Edmond.
Thank you. I don't consider the remark that I made to be a snide one. If your position is that there has been a reduction, can you provide me with the statistics? I now refer to 1216600 that deals with building. 19.4 has been allocated. Under the description of the project, there's a provision for room, DNA cupboard, and trestle. Can the Honorable Minister state the specific sums that has been allocated for the cupboard and the trestle, and whether one contractor will be providing the service? This is a very important question, Minister. You are accountable to the people.
Honorable Minister.
Thank you, Mr. Chairman. I only not want to be accountable to the people, but accountable to Ms. Gita Chandler Edmond, who's my shadow. And I will just say for the 2021 rollover projects that these projects were publicly advertised for. There's an extension of the Secretariat building. You may see it when you pass on the road now, it's $11.8 million. The supply and installation of cubicles, which appears to be extremely important, is $1.1 million. The supply and installation of a sanitation tunnel is $128,000, all for a subtotal of $13 million. In terms of the 2022 projects, there's a construction of a storage room, $2.5 million, construction of a required specific technical DNA cupboard with sink for Turkine for the forensic lab, $1.9 million. The construction of the trestle, $1.959 million. Total for both, $19.4 million.
Thank you, Honorable Minister. Honorable members, Honorable Member Ms. Chandler Edmond.
Thank you again, sir. I refer to 2405800 land transport. 12.7 million has been allocated. Can the Honorable Minister indicate the number of vehicles he intends to purchase and which locations are expected to benefit from the purchase?
Honorable Minister.
Thank you, Mr. Chairman. Honorable Member, there was a rollover procurement of a vehicle, $3.7 million, and for a minibus for 2022, not a rollover procurement, $9 million, for total $12.7 million.
Thank you, Minister. Honorable Member Ms. Chandler Edmond.
Thank you again, sir. I refer to 2609100, community policing, 24.1 million has been allocated. This project entails the provision of motorcycles, outboard engines, ATVs, radios, etc. Can the Honorable Minister indicate which specific hinterland community groups will benefit from this purchase, the type of motorcycles that are earmarked for the hinterland community groups? And can you also indicate the number of community groups that exist within the hinterland?
Honorable Minister.
Thank you, Mr. Chairman and Honorable Member. We have 177 community policing groups in Guyana. Those groups were re-established, rejuvenated, because they were practically shut down over the last period. When we came, the community policing system was dismantled, and much of the assets disappeared. The boats, the engines, the ATVs disappeared. We can't find some of them. We had to get the police to help us to recover some of that equipment. So The reason you may see an increase in the capital for this particular project area is because of that problem. If I were to say where all of these things are going to go, so it's 175 we have, and 177 we have, and we're going to create 175 new ones this year, beginning this year. And it goes with our overall posture of creating an environment in the communities where we interdict, give actionable intelligence on what are the stresses in the community so that we could reduce crime and violence and increase the peace in Guyana. And so the procurement of the ATVs and motorcycles is $5 million. The question handheld radios will also be provided, 25. Motorcycles, particularly 10 for $4.5 million. There's only one outboard engine, a Longfoot one, for Mabaroom and Santa Monica Mission, well, two, really. And 40 horsepower outboard engines for Shallow River Shortfoot, Charity Leguan and the Borbis River 4 for $8 million.
Thank you, Minister. Honorable Member, Ms. Chandon Edmond.
Thank you once again, sir. Minister, the question was very specific. How many of the motorcycles, ATV, etc., is earmarked for the hinterland community groups? And I commend you for the 177 community groups, but the question again is also very specific. How many community groups exist within the hinterland?
Honorable Minister, very specific.
The motorcycles are for all regions, but mostly for the hinterland areas. So that is basically the answers.
Thank you, Minister. Honorable Member, Ms. Gita Chandon Edmond.
Just for the purposes of clarity, I may have missed it. Did you indicate, Honorable Minister, the number of community groups that exist within the hinterland?
Honorable Minister.
I will lay over for purposes, Mr. Chairman, for the information clarification, which ones are for the hinterland regions. But just to say, from January to December 2021, we formed 176 groups with 2,531 members. 34 youth groups with 981 members, 12 women's groups with 190 members who also created. And these are all in the hinterland region, mostly. Groups are formed in the interior areas which never had existing groups. Maruka, Oriala, Santa Mission, Siraputa, and Mabaruma, those are some of the areas. Since the honorable member is interested in the groups which are formed over the period, Madhya 1 and 2, Campbelltown, which is a subset of Madhya, Cabana, Walaba, Kamwata, Mora, Haimara, Cabra, Waramuri, Rincon, Karaburi, Parakesi, Arakaka, Anai, Toka, Karasabai, Napi, Shulenap, Katunarib, Sawaro, Awareno, Shia, Agatash, Dark Point, Kapuri, Riversview, Karo, Itabali, Santa Arta, Friesland, yes. And I can call all of them if you have the patience. So
Honorable Minister, we may not have the time, though.
Okay. Thank you, Mr. Chairman.
Honorable Member, Ms. Chandon Edmond. Thank you very much, Honorable Member.
Speaker.
Honorable Member, Mr. Holder.
Mr. Speaker, on the same line item, is the minister saying that the police is incapable of investigating theft from the police, which was committed from the police? Because I heard him saying boats and so went missing. So I'm asking if the police is incapable of investigating theft within their own department.
Honorable
Mr.
Minister.
Chairman, an honorable member, I never suggested from the floor of this House that the police were incapable of investigating or dealing with theft from amongst themselves. That's the first issue. The second issue is that the community policing groups are not police. They're volunteer persons who, on their off time or whatever, assist in the community in relation to policing activities. So this issue has nothing to do with the police in itself. I did say, however, that we have to get the support and assistance of the police to recover boats, engines, ATVs, pickups, all kinds of items which were with the community policing groups, in some cases misused for political purposes. We had to get the police to help us get those things back. So there's no conflation between the activities of the police and its capability of doing its own internal investigations for any indiscretions of police itself and the activities in terms of the community policing group. The community policing group persons are not police.
Thank you, Honorable Minister. Honorable Member, Ms. Joetta Finance.
Thank you, Mr. Chair. Could Honorable Minister say the list that you called out a few moments ago as to the policing groups, you mentioned that they are new policing group, but then on that list you had an area that I'm very familiar with, which is Agatage. So I know for a fact that Agatage had a functioning policing group. So the question is, sir, if these groups that you're referring to as new groups have actually replaced existing groups, because then the use of the word new is giving us the impression that it was never there before.
Thank you, Honorable Minister.
Thank you, Mr. Chairman and honorable members. My view is that these are new community policing groups. The groups were disbanded, their equipment was taken away, their pickups and trucks were taken away, their means of transport were taken away, their little shotguns were taken away. So, former minister overlooked the dismantling of the community policing group system in Guyana. And that is a fact. It's a fact. We have to get new people and get new members in the community to reform the groups, to resuscitate the system. And that's a fact.
Thank you, Honorable Member, Ms. Finance.
Thank you, sir. Just one follow-up, sir. Could the Honorable Minister give the specific date that the group that he's referring to as new for Agatage was established, and what was the date that the group that was there before was not in place anymore? Thank you.
Thank you, Honorable Minister.
The information will be provided for the Honorable Minister.
Thank you, Honorable Minister. Honorable members, I now put a question that the sum stated for Agency 511, Policy Development and Administration Capital Expenditure of Agency 51, Ministry of Home Affairs, stands part of the estimates. Those in favor say aye. Those against say no. The ayes have it. The sum stated now stands part of the estimates. Honorable members, can we now turn to page 394 and 395. And I propose a question that the sum stated for Agency 51, Ministry of Home Affairs, Program 512, Guyana Police Force current expenditure stands part of the estimates. Honorable Member Ms. Geeta Chandan Edmond.
Thank you again, sir. Honorable Minister, I refer you to line item 6302, training. I noticed that there is a substantial increase of 41 million, and I want to say to you that this is very commendable. It means that you are investing in our personnel and you're provoking yourself. And can you indicate to me the number of officers that will benefit under this line item, the areas of training, the departments from which they will come? And also, can you indicate to me whether a SWOT feasibility or gap analysis was done on the Guyana Police Force to determine the critical areas that need training and the areas of training? If yes, can you indicate when this guiding study was done, the outcome, the findings, and the analysis?
Honorable Minister.
Mr. Chairman, honorable members, it's unfortunate that the former Minister of Public Security is allowing someone else to face the music in respect of issues for which he has intimate knowledge. No. My erstwhile friend, honorable member, Ramchatan. Mr. Speaker, we speak of an increase of 50.86%. This involves the training, both national and overseas, lecturer fees. More courses will be conducted in 2022. And 300 persons, 300 policemen and women are identified for training so far. And much of this training, there's a memorandum of understanding between the Guyana Police Force and the University of Guyana in respect of training for police officers for the first time. And just to say, this is incipient to our setting up soon a police academy. And I also have to point out that there's a strategic management plan which has components specific in respect of training. And that strategic management plan is 2022-2026. So amongst this item, they're trained the trainers for 5.7 million, safety and security management diplomas for 9.875 million, strategic intelligence gathering, 6.2 million. There is going to be a degree in public management training, $19 million. They further designed the tweaking of the strategic management plan for $1.5 million, a bridging course to qualify for advanced security management masters, $16.9 million, and critically now for training in cyber security, $10.8 million, totaling some $70 million.
Thank you very much, Honorable Minister. Honorable Member Ms. Chandan Edmond.
Thank you, sir. Minister, are you prepared to lay over this guiding study that you made reference to?
Honorable Minister.
We can, yes, certainly, Mr. Speaker, we can give some information. There's nothing to hide.
Thank you, Honorable Member Ms. Chandan Edmond.
Thank you very much. Once again, Minister Ben, that's very commendable. Like I said, you're provoking yourself only. I refer to line item 6311 that deals with rates and taxes. 278 million is allocated. Can you please indicate to me how much of this 278 million will be paid for the properties in Georgetown?
Honorable Minister.
Mr. Chairman, I can't say off the cuff what proportions. We'll have to spread it out against all the other police stations in all the other communities in all the other towns. Yeah, we'll have to lay it over. I can't. We'll have to sit with the mayor and city council and see what they're claiming for.
Thank you very much, Honorable Minister. Honorable Member, Ms. Chandler Edmond.
Thank you. Minister, are you committing to providing this information within a week?
Honorable Member, Ms.
Thank you, Mr. Chairman. Once we get the requests or from the various, from Georgetown itself and the other townships, we can give the information as soon as it is ready, based on what they give us from the city of.
Thank you very much, Minister. Honorable Member, Ms. Chandler Edmond.
Thank you again, sir. Honorable Minister, I refer you to line item 6116. I noticed that there is an increase of 64 contracted employees, and the sum of monies has increased also. Can the Honorable Minister lay over in writing the designation of the 64 new employees, their emoluments that take the sum from 57 million to 291 million?
Honorable Minister.
Mr. Chairman, there's no mystery to this thing, as Honorable Member Ramjatan would know. The contracted employees, this increase is related to coming into operation of the police command center, which is nearby. We've had to employ intelligence video system operators, 57 of those, policy analysts, a legal advisor, engineer, a human resource assistant, and basically the same thing in terms of all the legal advisor, a lawyer, a junior legal advisor, an attorney at law, financial analyst, a pathologist, a communications coordinator, policy analyst, a forensic auditor, a PRO, an engineer, counselors, human resource assistants, and the aforesaid IVS operators and a clerk of works.
Thank you, Minister. Honorable Member, Ms. Chandler Edmond.
Thank you again, sir. Minister, I refer you to 6231. I noticed that the sum in this line item has increased by only $2,500. With us being an oil-producing state, major investments are taking place daily. One would have expected that the ministry would have had more plans and programs for patrol, etc. So I believe that there should have been an increase in this line item. As I said in my budget speech, we are an oil-producing state, and we have to operate in that manner to protect our environment and be prepared for anything.
Honorable Minister.
Mr. Chairman, honorable members, the honorable member previously was harping on the fact that there was an increase elsewhere in respect of fuel and lubricants. And now, where in respect of the police, where we are showing that we have better control based on their advice, in respect of the new vehicles which are coming in, better control over accounting for the fuel and lubricants and for their use, we only have a 0.44% increase in the request. I think we should be very satisfied with that.
Thank you, Minister. Honorable Member, Ms. Chandler Edmond.
Thank you, sir. Just for clarity, Minister, when I asked the question previously under the other program, I was not querying on the amount allocated for that line item. I merely inquire whether the staff were trained in the store operation procedure.
Thank you, Honorable Member. Honorable Members, I now put the question. Honorable Member, Mr. Mahipo.
Yes, sir. I have to have a touch at this. Sir, this same line item 6116, contracted employees. Can the Honorable Minister indicate what recruitment procedure was followed for the employment of these additional staff? And if there were public advertisement, would the Honorable Minister be kind enough to lay over in writing?
Mr. Chairman, honorable members, the employment for persons to the police force relies specifically at these levels, beyond where there are advertisements for persons at the higher levels, for persons who apply to the Guyana police force for employment. And that is how the IVS operators were interviewed. They applied, they were interviewed, they were screened, they were trained, they were placed and accepted if they performed in their job in respect they were. And then there are some persons who are bonded employees, like the engineer and the human resource assistant and some others from the public service ministry.
Thank you, Minister. Honorable Member, Ms. Ferguson.
Thank you very much, Mr. Speaker. Pleasant afternoon to you and to the Honorable.
And to you too.
Nice to see Mr. Hicken in the house today.
I think the Honorable Member, Mr. Ramjatan, set the tone early this morning.
Okay, sir, good. May I turn the Honorable Member attention to line item 6272, electricity charges. I note that in 2021, you had 178 million. And there's a revised sum for 2021, 163,638,000. And I note that there is a slight increase for 2022 of 178. Can the Honorable Member explain the reason for the increases and which areas within the Guyana Police Force is likely to benefit from these allocations? Thank you.
Honorable Minister.
Thank you, Mr. Chairman. By the honorable member's own admission, we are speaking of a slight increase, and it relates to the coming into operation of new buildings, new police regional command places, new housing for police officers, the command center and other areas throughout the country.
Honorable members, I now put the question that the sum stated for Agency 51, Ministry of Home Affairs, Program 512, Guyana Police Force current expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it, the sum stated now stands part of the estimates. Honorable member, let's turn to page 666. And I propose a question that the sum stated for Agency 51, Ministry of Home Affairs, Program 512, Guyana Police Force, capital expenditure stands part of the estimates. Honorable member, Ms. Geeta Chandan Edmond.
Thank you again, sir. Minister Ben, I refer you to 1216800, police station and building. There's been an excess of 1 billion here. And again, I have no issue with this, and I believe you should be commended. Under the description of the project, I note it's for the completion of Mabaruma, Rumville, Providence, Yarikita, etc. Can you indicate the projected dates for completion of the listed police station and a detailed breakdown on the amounts to be spent? And can you also indicate what is the status of the Albion, Wim, Madia, and Wisma police station? Are the works completed? I recall these works commenced in August 2020 under the Security Strengthening Program. Also, can you indicate whether the rehabilitation works at Parika Station are completed?
Honorable Minister.
I think, Mr. Chairman, at Parika Police Station, the rehabilitation works will finish. We have a long list of police stations for which works are underway. Some are rolled over. We expect that by the end of the second quarter that all of these would be at practical completion. I may call out in respect of the rollover, Mabaruma, 21 million, Rheinveld reconstruction, 32 million, Providence, 36 million, Yarakita, which just started, 20.6 million, Charity, minor works, 2.7 million, Mbaimadai, 13 million, Camarang, 14.8 million, Kurupong, 7.8 million, Keto, 8.8 million. And there is the construction of living quarters at Fort Kaituma for $686,000. And we have a completion to do of the senior officers living quarters at Eve Leary for $11.7 million. In respect of activity for new police stations or for 2022 projects, new projects, we have an allocation of $405 million for the construction of a new Brickdam police station. For regional command operations stations, we will be doing work at Anna Regina, Leonora, Fort Wellington, the Central Police Station, and at Wismont for $150 million. We will be upgrading the TSU operational area for $40 million. There will be construction of a floating ramp for the Marine Police at Rheinveld for $12 million. We intend to reconstruct the CID headquarters building for $28 million. We will also be doing new living quarters at Eve Leary for $25 million. The Special Constable headquarters will be redone for $20 million, and there will be rehabilitation at Barometer for $20 million, Charity for $36 million, Rose Hall for $20 million. The Brickdam barracks are under rehabilitation, forced on by the issues with the fire there of $20 million. Tushen will get a police station, proper $19 million. The Namsel will be rehabilitated. The boathouse at New Amsterdam will be done for $10 million, and there will also be a new ramp for that for $8 million, a total of $1 billion, basically.
Thank you, Minister. Honorable Member, Ms. Chandler Edmond.
Thank you again, sir. Honorable Minister, I believe you may have missed. I did ask what is the status of the Albion, Wim, and Perico Police Station?
All of these, thank you, Mr. Chairman, all of these, honorable member, are at practical completion.
Honorable Member, Ms. Chandler Edmond. Thank you very much, honorable members. Honorable members, I now put the question. Honorable Member, Ms.
Chair, I'm on my feet. Thank you very much, Mr. Chair. Mr. Chair, the very line item, 1216-800. Earlier, the honorable member listed a number of buildings currently under construction or will be constructed. I heard Charity for some $30 million. Perhaps you can correct me there, but as far as I'm aware, Charity is currently under construction, if my memory serves me accurate. And secondly, can the honorable member state for this assembly and the people of Guyana whether there is a design for the new Brickdam building? I note we're expected to expend some $4+ million. So we would like to see, like to know what this new architecture will look like.
Thank you, Honorable Minister.
Thank you, Mr. Chair. It was 36 million for the charity station. In respect of the new police station, Brigham Police Station, we have had 3 conceptual designs, of which we have adopted one. We intend to get, along with our engineering group, which has been enhanced by the employment of our own engineers, we intend to work with some consultants in respect of the structural design, the foundation design, and issues related to the reticulation in the building for fire, water, and electricity.
Thank you very much, Honorable Member. Thank you very much, Mr. Chair. To the Honorable Member, am I to understand the construction of the charity police station cost 36 million as final cost, or you're paying a retention fee, or what is it this 36 million will take care of? Thank you.
Thank you very much.
There were some added costs in respect of electricity and the finishings for the building. At charity, there were some problems in relation to the foundation for the building. There's a lot of pegas and stuff at the bottom there. So some additional work had to be done, which affected some other issues in the building.
Thank you very much, Mr.
Honorable Member, Ms. Ferguson.
Thank you very much. Sir, to the Honorable Member, you said that there were, some issues with the foundation, but can I get from you whether soil testing was done to determine the kind of structure to be placed there, rather than the building is partially constructed and now we're being told that the foundation had some issues. So is it that we were putting the cart before the horse?
Honorable Minister.
No. Initially, for a project which we inherited, the honorable member may recall, it was for rehabilitation of a building. That was what it was embarked upon. When we made the discovery of the issues, we had to move from rehabilitation to construction. An inherited project.
The building was up.
Honorable members, Honorable Member Mr. Mahipal, and this would be the final question we will have under this agency, as we have just exhausted the 1 hour which has been allocated. Mr. Mahipal.
Sir, land and water transport, 24,05,900. There is a cost there of 300 million for the provision of vehicles, motorcycles, boats, and engines. And we also have the breakdown to 257. That speaks to trucks, minibuses, motorcycles, boats, and engines. So when my honorable colleague Gita Chandan Edmund asked in respect to fuel and lubricant, the Guyana Police Force has an existing fleet of vehicles, and they spent 457,995,000 in 2021 for the vehicles that are currently existing. And now they're endeavoring to purchase more vehicles, which is very good to enhance security and so on in our country, traveling more, doing what has to be done. But there's only an increase of $2,005 in the allocation from what they spent in 2021. So I think it is relevant for me to ask again if the fuel and lubricant figure is adequate for the vehicles that exist and the ones that are the Guyana Police Force is endeavoring to purchase.
Honorable Member, Minister Ben.
Thank you, Mr. Chairman. I want to thank the honorable member for his great interest in this matter. The there is, in fact, if we had paid some attention, to a replacement of vehicles. Vehicles have been boarded, which are old, which are not operated. The new vehicles which we are bringing in or have acquired are more efficient on fuel and lubricants. So, based on the calculations and taking into account those issues, this is the number we have come up with. If for some extraordinary reason we are required to get into more operational activity using the vehicles, we'll come back for supplementary. But this is the basic reason that we have the number we're speaking of. New vehicles, more efficient vehicles, and replacement of vehicles.
Thank you very much, Honorable Minister, for the basic reason. And I basically now have to put all of the heads as we've exhausted the time. Honorable members, I now put the question that the sum stated for Agency 51, Ministry of Home Affairs, Programs 512 Guyana Police Force, Capital Expenditure, Programs 513 Guyana Prison Service, Capital Expenditure, Program 515 Guyana Fire Service, Capital Expenditure, Program 516 General Registrar's Office, Program 517 Customs Anti-Narcotics, Capital Expenditure, Program 513 Guyana Prison Service, Current Expenditure, Program 515 Guyana Fire Service, Current Expenditure, Program 516 General Registrar's Office, Current Expenditure, and Program 517 Customs Anti-Narcotics, Current Expenditure, all stand part of the estimates. Those in favor say aye. Aye. Those against say no. Ayes have it. The sum stated for this agency and all of the heads I put now stand part of the estimates. Thank you, Honorable Minister Brinley Horatio Ben, and all of his staff for taking us through his agency. Thank you very much. As the Honorable Minister Horatio Ben and his team departs, let us welcome the Honorable Senior Minister in the Office of the President with responsibility for finance, Dr. Ashwini Kumar Singh, and the staff at the Ministry of Finance to the Dome to consider the estimates for Agency 3, Ministry of Finance. Yes, Honorable Member Mr. Mahipal, I wanted to take a break, but we took an extra long lunch, which was only an hour ago that concluded. Honorable members, we will turn to page 96 and 97. Thank you, Honorable Minister. Welcome to you and your staff. Honorable members, I propose the question that the sum stated for Agency 3, Ministry of Finance, Program 031, Policy and Administration, Current Expenditure stands part of the estimates. Honorable Member, Ms. Fernandez.
Thank you, sir. Line item 6141. Mr. Chair, last year the public servants had a one-off across the board, rather, 7% under this line item, sir, we see an increase from the allocation of $10 billion last year to 15.89 this year. Could Honorable Minister say if this indicates that the public servant should be enjoying a higher increase than 7% this year?
Honorable Minister.
Thank you very much, Mr. Speaker. I believe it is relatively well known and has been abundantly ventilated in this Honorable House that line item 6141, styled Other Employment Costs, is a line item that is intended to meet and serve multiple purposes. It is the line item that historically has met the cost of miscellaneous employment costs not elsewhere budgeted for, including such items as new recruits, because of course we have a time-honored principle in the central government of budgeting only for filled vacancies, persons who are currently in post within the individual budget agencies. And so if one were to take, for example, the budget for the Ministry of Home Affairs, which we have just completed consideration of, that budget will reflect in the employment costs under their respective programs an allocation to meet the persons who are currently in position. We have, of course, continued to respect this time-honored principle, and so across the entirety of the budget, across the full spectrum of budget agencies, the funds allocated for employment costs are intended to meet the cost of persons who were in position at the time that the budget would have been completed. But of course, during the course of the year, for one reason or another that might emerge from time to time, new recruits might be employed for whom an allocation would not be available within the respective budget agencies. And so this other employment cost line item will meet the costs associated with those new recruits. So the first and perhaps most popular application of this line item is the cost of new recruits. Secondly, of course, one might have revisions to wages and salaries for a variety of reasons. For example, as a result of promotions, a person might be occupying a particular post at the time that the budget is concluded, but during the course of the year is promoted or might have their wages and salaries revised, whether for purposes of reclassification or assignment of additional duties, payment of a responsibility allowance that was not previously anticipated at the time that the budget was concluded, or a variety of reasons. Those revisions, the cost of those revisions are also met from this line item. So you might have new recruits, you might have revision of wages and salaries for a variety of reasons. And then, of course, like the honourable member quite rightly identifies, the costs associated with the salary increase that is eventually to be concluded and awarded whenever that is concluded and awarded. And so the allocation, this allocation also meet the costs of the salary increase that is to be paid for the fiscal year in question. As to the specificities of that salary increase, it is, of course, needless to say, sir, it is, of course, far too early for me to determine. But once determined, sir, the salary increase that will be paid will, in fact, be met from this line item. Thank you very much, sir.
Thank you very much, Honourable Minister. Honourable Member, Ms. Finance.
Thank you, sir. Mr. Chair, in the interest of time, I'll ask two questions together. Follow-ups on the same line item. 6141, water employment cost. Thank you, Honorable Minister, for that detailed explanation of that line item, sir. I want to note this question is specific to last December. Actually, there was a commitment to the doctors and nurses to have this one-off payment. However, those doctors and nurses that does not come under the Ministry of Public Health and rather comes under the Ministry of Social Protection did not receive any monies from that payout. I'm asking, since I know that this particular line item could also cater for some one-off payments, if there is any provision for the doctors and nurses that were not paid from the ministry, that falls under the Ministry of Social Protection for this particular line item. And also, actually, answer that one first, because the follow-up will come from your response.
Certainly, sir. Thank you very much, sir. The honourable member is absolutely correct. The announcement made by government last year to pay the one-off bonus payment to frontline workers in the health sector was in fact met from this allocation in 2021. I must admit that I'm not in a position to pronounce on the specificities of any particular subset of workers, whether I think the honourable member mentioned the Ministry of Human Services, I believe.
Yes, correct.
I must admit that I'm not in a position I don't have in my possession currently information pertaining to that particular subset, but health workers who were paid this bonus were paid from this line item. Thank you very much, sir.
Thank you, Honorable Member, Ms. Finance.
Thank you, Mr. Chair. And I just want to say that I understand your explanation. Thank you for that explanation. And I know that I have engaged the Minister, Minister Honorable Vinny Bissard, on this matter, and she said she's working towards seeing how she can get those persons, get the payment for them. So that is something I hope that we can actually achieve under this particular line item, because I think that there was just some kind of miscalculation or something and they were left out. Nevertheless, sir, you acknowledge that increase in wages and salaries also would fall under this particular line item. So my question is, on the level of policy level side of it, Mr. Chair, is the Minister of Finance going to be meeting with the Guyana Teachers Union, the Guyana Public Service Union in negotiations for these increases that are projected under this budget?
Honourable Minister.
Thank you very much, Mr. Speaker. Let me assure the honourable member that this People's Progressive Party civic government is firmly committed to working closely with all stakeholders in society, including, of course, organized labour, on all matters of national importance. Thank you very much, sir.
Thank you very much, Honourable Member, Ms. Finance.
Thank you, sir. Thank you for that commitment, Honourable Minister. Could Honourable Minister give a timeline as to when those discussions are expected to begin?
Honourable Minister.
Thank you very much, sir. The Honourable Minister is pleased to say that this government, throughout the year, is open, available, and eager to engage with all stakeholders in society. Thank you very much.
Thank you very much, Minister. Honourable Member, Ms. Finance.
Thank you, sir. Moving away from this line item one bit, moving to line item 6242, maintenance of building. I see the budget for that line item is $58 million. Could the Honourable Minister give us a breakdown of what that $58 million is going to cover?
Honourable Minister.
Thank you very much. Certainly, sir, this is going to cover rehabilitation of various parts of the Ministry of Finance's facilities, including rehabilitation of northern and eastern walls, interior walls, timber floor, network recabling, ceiling works, electrical, rehabilitation of roof, electrical maintenance, miscellaneous repairs, etc. Now, I rather suspect that the line has attracted the members, attracted or aroused the members' interest because of what might appear to be a significant increase. And I will say in relation to that matter that there is some long overdue rehabilitation that is required in the roof. I can't say why that work might not have been done during the 2015 to 2020 period, sir, but it is indeed long overdue, and we are proposing to do that work finally this year. So that is the specific item, addressing long overdue and much postponed rehabilitation to the roof. That's the item that accounts for the increase.
Thank you very much, Minister. Honorable Member, Ms. Finance.
Thank you, Mr. Chair. Thank you, Honorable Minister, for that explanation. I recall that explanation, I believe, was given last year when $34 million was budgeted under that line item. However, the revised figure is only 11.7 million being utilized. So we have no, based on that indication, we don't know what percentage of the $58 million would actually be utilized this year, sir. Sir, line item 6264. Vehicle spares and service. I see the allocation for 2022 being 14.4 million. I see that 2021, the budgeted figure was 13 million and the revised figure was 6.2. So by what indication, what caused this projection to be 14.4 for 2022?
Thank you very much, sir. Before I move on to the vehicle spares, let me return to the maintenance of buildings and refresh the honourable member's memory. The honourable member suggests that an explanation was proffered last year in relation to this line item. The honourable member perhaps has forgotten that she and her colleagues stormed out of the National Assembly long before we got to the Ministry of Finance's consideration of estimates. And the record would reflect, in fact, that the opposition did not avail itself of an opportunity to ask questions on the Ministry of Finance estimates. So this alleged question that was posed and explanation that was proffered is, in fact, either a figment of the honourable member's imagination or a deliberate fabrication. But I will withdraw the latter, sir. Suffice it to say, and for purposes of emphasis, when the Ministry of Finance estimates came up for consideration last year, the opposition had already withdrawn from consideration of the estimates. And I would urge the honourable member to desist from creating an inaccurate impression. This minister was not asked any question on this line or on any other line in the Ministry of Finance estimates. And to suggest otherwise, sir, if I might respectfully suggest it, to imply or suggest otherwise, sir, is either the product of an overactive imagination or some other sinister motivation.
Okay, you have to withdraw the second part.
Happily, sir.
Thank you.
Happily, sir.
Imputing.
In relation, sir, to the question of vehicle spares and service, the ministry has inherited a fleet of dilapidated vehicles that appear to have suffered abandonment and extremely poor maintenance over the course of the 2015 to 2020 period. We have started rather to conduct an assessment of that fleet, and we have discovered, in fact, that some of the vehicles are in need of very significant maintenance. Some, in fact, we're in fact considering how to proceed with this fleet. But some of the vehicles, as many of the vehicles as we can possibly bring back to being in serviceable quality, we will endeavor to do this. This, sir, in fact, is it is a stark illustration of what happens when there's poor or non-existent maintenance, as there apparently was during the 2015 to 2020 period. Thank you very much, sir.
Thank you, Minister. Honorable Member, Ms. Finance.
Thank you, Mr. Chair. The Honorable Minister is absolutely correct about last year on the line item 6242, where we're discussing the $58 million. And I'm happy that the Honorable Minister reminded his House that he wasn't here to answer this question. So my question back to this line item 6242, since Honorable Minister did not have the opportunity to answer these questions, sir. We see the $58 million being...
No, sir. Might I, sir?
Honorable Minister, I was just about to ask the Minister to rephrase that she was not here to provide herself with the opportunity to ask the question.
I could not possibly, sir, with the greatest of respect, sir, I could not possibly answer a question that was not asked.
Thank you.
Thank you very much, sir.
Honorable Member, Ms. Finance, please continue.
Thank you, Mr. Chair. Mr. Chair, again, this year, under the line item 6242, we have an allocation, as we're seeing, of $58 million. Sir, based on the 2021 allocation of $34 million, we see the revised figure coming back at $22.272 million less. So what indications can the Honorable Minister give to us? When does this work? What is the timeline given for the start of these work now? Because we see that you did not spend $22.272 million under that line item last year as was budgeted for. So when do you intend to start work on this line item this year so that we can actually use up that $58 million, sir?
Honorable Minister.
You just got to press again, 2 times. You got to press it again. No, you got to press it again. It's not. No, sorry, my mic is getting the same issue. You just have to press it 2 times. Sorry, I have no attempt to.
We may have to check under the Chief Whip chair, because the last time it was the Chief Whip chair. Let me cut off and then you can put back on. Go ahead, Minister, try again. Okay, we may have...
No, I can see the red light. Thank you very much, sir. Just to clarify...
Try again.
Yes, sir. We're on. Just to clarify, sir, in fact... Sir, it would appear that the Chief Whip on that side of the House is up to his old tricks.
No, you're imputing the Honorable Minister.
I would gladly withdraw once again, sir.
I was referring to the Chief Whip on this side. We may have to check on the Chief Whip's desk.
Sir, my memory isn't what it used to be when I was younger, but my recollection is that it was the Chief Whip on that side of the House that appeared to have some electrical wiring under it. But be that as it may, the microphone is working.
That controlled the mics on his side.
Very well.
I was similarly concluding that maybe it's on your side.
Very well, sir. Thank you.
Okay now? Okay, we
I think we're on now. I think we're on now.
Yeah, we did stop the clock.
Sure.
We will provide the 4 extra minutes.
Sir, in relation to the question asked by the honourable member, some of the works to which I referred earlier, in fact, has already been started. So work in relation to the rehabilitation of some of the exterior walls, some of the interior work, including on the full flooring and the interior walls, and some of the network recabling. That work, in fact, has already been initiated and will be continued during this year as rollover projects. And the remainder of the work we will initiate with the greatest of expediency. In fact, some of this work is in fact going to be tendered, is going to tender as early as next week.
Thank you very much, Honourable Minister. Honourable Member, Ms. Finance.
Thank you, Mr. Chair. We were tracking that timeline. Thank you, sir. Sir, line item 6284 other. I know that the Honorable Minister proffered an explanation in this House, I believe it was yesterday, as to what this line item takes into consideration. However, I believe that it was my colleague, the Honorable Ganesh Maipal, that highlighted that he did not mention some of the things like, advisors and so that we have been pulling out of this particular line item. So we see for the allocation under this line item for 2022, it's $170 million. Can Honorable Minister kindly just disaggregate this figure? It's coming from the revised figure in 2021 being 56.414 million.
Certainly, sir.
Honorable Minister.
Thank you very much, sir. We have the honourable member acknowledges the explanation that I offered yesterday in relation to the potential I provided, I think, an inexhaustive list of potential applications of this miscellaneous expenditure item. Include in the particular instance of the Ministry of Finance, this line item also meets expenses in relation to legal fees and pending legal matters. And we have been, since we have assumed office and since we have been in the course of taking stock of pending matters, confronting the government, we have been discovering a number of pending legal matters for which provision might need to be made. And so this allocation is intended potentially and hopefully, sir, to cover all such matters as might be identified during the course of the year.
Thank you very much, Minister. Honorable Member, Ms. Finance.
Thank you, sir. Sir, just a follow-up on that. What proportion of $170 million would be actually allocated towards legal fees?
Honorable Minister.
I would say, sir, potentially in the order of, if I might be permitted to round it up, potentially in the order of about $150 million.
Honorable Member, Ms. Finance.
$150 million towards legal fees. Could the Honorable Minister say how many cases does this entail?
Honorable Minister.
Regrettably, sir, the Honorable Minister is not in a position to provide that information now.
Could that,
Honorable Member,
thank you,
Ms.
sir.
Finance.
Could that information be laid over?
Honorable Minister.
Not easily, sir, because like I mentioned earlier, we are in the process of unearthing these. There's an inherited stock of pending matters that as we have gotten settled into office and taken stock of the variety of pending matters, so we're in the process of unearthing these. So I'm not, regrettably, sir, I'm not in a position at this stage to provide that information.
Thank you, Minister. Honorable Member, Ms. Finance.
Thank you, sir. Moving on from that line item, 6302, training, including scholarships. We have a budgetary allocation of $4 million. I noticed that the budgetary allocation for 2021 was also $4 million, but no money was expended out of that in 2021. So what training is the minister proposing to be done with this $4 million?
Honorable Minister.
Yes, sir. In fact, we have an allocation, sir, both under Program 1 and Program 2 for training. In fact, I believe under Program 2 there's also an increased amount for training. We have identified a number of areas in which critical training is needed, areas relevant to the work of the ministry and more broadly areas relevant to financial management across government. These include, if I might be permitted, in anticipation to address the training line under Program 2 as well. They include things like, of course, public procurement. And this is not training only for the Ministry of Finance, but it's also training for procurement officers and persons working across the government service, government accounting, government financial management, use of the integrated financial management and accounting system, the IFMAS, because we have lots of new accounting officers and staff who have been recruited over the years and who have never really quite, we have discovered, never really quite benefited from this kind of training. So this is in fact, if I might, sir, with your permission, address both the Program 1 and Program 2 training, which I believe also reflects some increase. It's training in various aspects of government financial management, not just for the Ministry of Finance staff, but also for financial management staff more broadly. And in relation to the fact that the training was not executed during the course of 2021, we would very much have liked to have delivered this training, but regrettably, sir, it's proven to be extremely challenging to bring large groups of people together because of COVID-19. We discussed for some time the possibility of remote delivery, but we weren't quite able to develop the modules and have them in a way that would lend themselves easily to remote delivery. But hopefully, hopefully the situation will permit execution and delivery of this training this year, ideally face-to-face, so that we can have the kind of interaction that's needed. But if not, we might have to take a second look at the feasibility of delivering some of this remotely. Thank you very much, sir.
Thank you very much, Honorable Minister. Honorable Member, Ms. Finance. Honorable Member, Ms. Halley.
Thank you, Mr. Chair. I'm at line item 6321, subsidies and contribution to local organizations, the Statistical Bureau. I'm just querying whether or not this agency intends to do the census this year, since we're coming on 10 years since the last census.
Honorable Minister.
Absolutely, sir. We are, in fact, 2022 is in fact a census year in accordance with the 10-year cycle. And so I believe, did I refer to this in my budget speech? I think I may have mentioned, I think the honorable member, it might have escaped the honorable member's recollection. But there was a section in the budget speech that dealt with strength statistics, and in that section, I believe, if I didn't, I beg your forgiveness, but I believe in that section I did point out that 2022 will be a census year.
Thank you, Honorable Member, Mr. Mahipod.
Thank you, Comrade Chairman. Comrade Chairman, I go back to line item 6141. And I must say, in my budget speech, I made reference to the across-the-board 7% salary increase. And my concern was really with the regional chairs, vice chairs, mayors, and deputy mayors. And I want to say that the Honorable Minister was kind enough to say to me that he will endeavor to look at the matter, and once it satisfies the requirements to be a part of the increase that is going to be given, that he is going to endeavor to address the matter. I'm not a financial expert, sir, and I know that this was a 7% that was from 2021. I'm absolutely certain that once the requirement for the chair and vice chair, mayors and deputy mayors to also be a part of this across the board increase, they will be included for 2022. I believe the Honorable Minister will ensure that happens. My concern, however, is that that does not take away from the fact, should he be satisfied that they do fit the requirement, it does not take away from the fact that they were shortchanged in 2021. So my question is, as long as it is addressed by the minister and satisfies the requirement, it satisfies the requirement to be a part of any salary increase expected from this $15 billion, and they are going to get it in 2022, I would like to know if they will also be able to get that 7% that they were shortchanged with from 2021. And I have taken note, sir, that from the allocation in 2021, 218 million was not spent. 218,190,000.
Honorable Minister.
Well, thank you very much, sir. Since the honourable member has availed himself so astutely of the opportunity to place on the public record that he's raised this matter with me, I will reciprocate in kind and say that as soon as the honourable member brought this matter to my attention, I undertook, with the efficiency that is customary of the People's Progressive Party civic government, I undertook immediately to look into this matter and resolve it as the circumstances might dictate. And I will reciprocate by placing that on public record. Thank you very much.
Thank you very much, Honorable Minister. Honorable Member, Ms. Fernandez.
Thank you, sir. Line item, I'm going back to the line item 6 to 321, contributions to local organization. Looking again at the birth statistics, sir, we see, and the Honorable Minister is right in his budget presentation, he did speak, he said it's a significant year for statistics in Guyana and the region, and it marks the conduct of the 2020 round of the population and house census, but he also made reference the census will utilize geographic information system to improve mapping and so forth. But my only difficulty, sir, is that the revised 2021 contribution was 604.330, and the budget for 2022 is just $1 billion, is just 395.670. So I don't see how we're catering for this huge census across the country with that small increase to that agency, sir. So can the Honorable Minister please explain to us how is this going to cater, how is this small increase going to cater for this census for 2022?
Honorable Minister.
Certainly, sir. Notwithstanding that a census is typically associated with a particular year, so you have census 2012 or census 1990 going back some years, 2000 or whatever. In this case, you'll have census 2022. Notwithstanding that a census is associated with a particular year, quite a lot of the preparatory work starts long before the census year. And so the Bureau of Statistics would have already started preparatory work, including things like developing some of their draft data collection tools, initiating preparation of their questionnaires, their field manuals, doing some of the pre-testing, setting up the IT systems that are required for the purposes of collecting, collating, consolidating, and ultimately analyzing the data that would be collected. Yes, sir. Would the honourable member like me to restart my answer? Okay.
Honorable Member, I'm hearing
very well.
tell someone in a
No, she asked the
conversation.
question. She asked the question, but she looked momentarily distracted. So I was offering.
Yeah, because I think someone is on a phone or something.
Ah, very well. So quite a lot of preparatory work. Quite a lot of preparatory work would already have taken place in the year before the census. So in fact, in 2021, embedded in that revised amount for 2021 is in fact some expenditure that would have been incurred in association with the preparatory work. Because given the vastness of the endeavor that a census is, it's a once in a decade activity, quite a lot of the preparatory work happens. And in fact, the honourable member might recall from previous censuses that the census activity doesn't get completed in the year in which the census is executed. And so in fact, work will continue beyond 2022. One will see in the budget for 2023 work continuing on the analysis of the data. It's collating, like I said, collating, consolidating, compiling, analysis, preparation of the census report, etc. Work will continue beyond fiscal year 2022 into 2023 in order to, so a census, while associated with a particular year, is in fact a multi-year activity. And so the honourable member can rest assured that in fact the 2021 expenditure would have included some amounts incurred in relation to preparation for the census. There will without a doubt be an escalation of activity in 2022, in particular because this will be the year in which the field work will be executed, the actual visiting to the households by the enumerators. And so indeed 2022 census day, once determined and announced, census day will indeed represent the epicenter of the census activity, but census activities will continue even into 2023. What we've done in budget 2022 is we've provided an indicative amount that we, given the information currently at our disposal, believe will suffice for the purposes of the 2022 census activities. This is our best estimate at the current time, given currently available information of what the 2022 activities connected to the census will cost. If during the course of the year we ascertain that work is moving more quickly than we anticipated, or that there are additional activities that are required to be executed, we will of course return to this honorable House in the manner provided for in law to seek supplementary appropriations. I hope that addresses the matter, sir.
Thank you very much. Mr. Honorable Member Ms. Fernandez.
Thank you, sir. Sir, could I ask, Mr. Chair, how far into our time we are right now?
Yes, you can. We started at 3:10. I'm adding 4 minutes onto the time. We are now at 3:48. We should complete at 4:10, which will now become 4:14.
Sir, could we kindly just move to the capital expenditure, sir? Thank you.
Honorable members, I now put a question that the sum stated for Agency 3, Ministry of Finance, Program 031, Policy and Administration, current expenditure stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, we can turn to pages 623 and 624. And I propose a question that the sum stated for Agency 3, Ministry of Finance, Program 031, Policy and Administration, Capital Expenditure, stands part of the estimates. The Honorable Member, Ms. Fernandez.
Thank you, sir. Sir, for Project Code 44-00700, Poverty Program, we see an allocation for $100 million. Could the Honorable Minister kindly indicate to this House how exactly this sum will be utilized?
Honorable Minister.
Thank you very much, sir. This is a program that is demand-driven. It supports needs for projects in communities and organizations across the country. It's demand-driven, and it's managed within the Ministry of Finance. We've set up an administrative structure within the Ministry of Finance to consider requests for these community-based or organization-based projects, and it's executed. These projects are executed through the Ministry of Finance in collaboration with the agencies involved.
Thank you very much, Minister. Honorable Member, Ms. Fernandez.
Thank you, sir. On the next page, we have Linden Enterprise Network on the contribution to local organization. We see an allocation in 2022 for $50 million for the capital contribution. Could the Honorable Minister say whether or not there's a board in place for this? If not, when would is the board expected to be in place? And lastly, I'm asking 3 questions to get on this particular line item. And how soon can the people of Linden expect to be able to utilize this?
Honorable Minister.
Thank you very much, sir. In answer to the honorable member's question in relation to the board is in fact not currently in place. It is a matter that is currently engaging the attention of government actively, and indeed, even in the absence of a board, the staff at Linden do relate very closely with the technical leadership of the Ministry of Finance. In fact, they are in close communication with the Finance Secretary and others in the ministry. And so we do still maintain a very close engagement with the team at Linden. But like I said, the matter of the appointment of the board is under active consideration, and I expect should be concluded forthwith.
Thank you, Minister. Honorable Member, Ms. Finance.
Thank you, sir. Project code 2601-200, Statistical Bureau. We see the allocation here being for the provision of storeroom, vehicle, furniture, and equipment. Could the Honorable Minister say, with regards to storeroom, where would the storeroom be located, and what would be in storage there?
Honorable Minister.
Thank you very much, sir. The storeroom is in fact at the Bureau's main office on Main Street. And it's a storeroom. I mean, I suppose it's a storeroom like any other storeroom. It is used to store consumables and equipment belonging to the Bureau.
Thank you, Honorable.
And I believe possibly records. I'm not sure, but definitely equipment and consumables.
Honorable Member, Ms. Finance.
Thank you, Mr. Chair. Just going back to the Linden Enterprise Network, I just want to know if there is a timeline on when the board will be put in place, because the persons will not be able to access this fund unless the board is put in place.
Honorable Minister.
Thank you very much, sir. I believe the word I used earlier was forthwith.
Honorable Member, Ms. Finance.
Thank you, sir. In the interest of time, could we just move forward to the other program, please?
Thank you very much. You're so kind. Honorable members, I now put a question that the sum stated for Agency 3, Ministry of Finance, Program 031, Policy and Administration, Capital Expenditure now stands part of the estimates. Those in favor say aye. Those against say no. Ayes have it. The sum stated now stands part of the estimates. Honorable members, let us turn to pages 98 and 99. And I propose the question that the sum stated for Agency 3, Ministry of Finance, Program 32, Public Financial Management Policies and Services Current Expenditure stands part of the estimates. The Honorable Member, Ms. Jorita Fernandez.
Thank you, sir. Sir, line item 6262, Overseas Conference and Official Visits, we see an allocation of $205 million. Can the Honorable Minister say what does this entail? What are the expectations of the ministry to utilize this funding for 2022?
Honorable Minister.
Certainly, sir. As the honourable member knows, of course, these are very unusual times in which we live, particularly because of COVID-19. International travel has changed significantly. Lots of the international meetings that previously were being held face-to-face are now being held online, or were being held, at least until last year, online. Some of this has changed, some has not. And so it's very hard for recent history to be a reliable basis on which to predict future activity in relation to this line. Some agencies are resuming face-to-face engagements, others are not. We anticipate some resumption of face-to-face interaction at the international level, but it's, the extent to which this materializes really is very closely connected to how the situation with COVID-19 evolves and how the international response to that evolution looks in the months ahead.
Thank you, Minister. Honorable Member, Ms. Finance.
Thank you, sir. On that same line item, we see the revised number for 2021 was actually 118.466 million. Could the Honorable Minister say if there was any other source of financing for the government's overseas trip from any state businesses within the private sector?
Honorable Minister.
Mr. Chairman, in relation to central government participation in international engagements, this is the line item that meets that expenditure. I do believe that there are one or two agencies that might have an allocation of their own. I don't know, I don't recall off the top of my head how much this has changed, but I believe that the GDF might have an allocation. In fact, I'm at the page now. The GDF also has an allocation under that line item. And I can't remember police has. Sir, so the only two, might I just confirm, sir, before I answer? I am advised, sir, that apart from the Ministry of Finance, which meets the central obligations of the government, the only other two agencies in the central government that have an allocation under this line, I am advised, are the Guyana Defense Force and the Guyana Police Force.
Honorable Member, Ms. Finance.
Thank you, sir. Sir, line item 6284, other. Could Honorable Minister kindly disaggregate the figure for 304,820?
Honorable Minister.
Thank you very much, sir. The predominant expenditure met under this line in the case of the Ministry of Finance is in fact software and user licenses. It would be recalled that the previous People's Progressive Party civil government had implemented an ICT solution for the purposes of government financial management, the IFMAS as it was then and still is known. Which is, of course, an automated, a digital solution for government financial management, and which requires us to pay software licenses and maintenance fees. So we have license fees for the IFMAS system. We have a subscription for the HR management system. We have enterprise business productivity licenses. We have enterprise platform systems licenses. We have enterprise software tools. We have the cost of connectivity for the purposes of government financial management. It would be recalled, of course, that all of the government agencies within, all of the budget agencies within the central government, we have connected to a single integrated financial management system. So that requires connectivity and the purchase of bandwidth. In some cases, fiber, and in some cases, the purchase of bandwidth. And then, of course, there are other things like security-based antivirus and firewalls, subscriptions, and so on. And then we are also, I'm pleased in fact to say, sir, that we're in the process of implementing an electronic funds transfer system and a real-time gross settlement system, EFT and RTGS as they are abbreviated. And these systems are intended to be used for the purposes of electronic execution of payments. In fact, on our return to government, we did issue an instruction that we should move to a point where all government employees are paid directly into their bank account rather than by way of checks. And I'm pleased, in fact, sir, to report that we have, as of, I believe, July 2021, we have achieved that objective of paying all government employees directly into their bank account, with the exception, sir, of government employees based in the far-flung regions, in regions where there isn't a banking, where the employees don't have ready access to banks. And so there are software fees and other charges associated with the applications that are required to support that capability, the EFT and RTGS capabilities. Thank you very much, sir.
Thank you very much, Honorable Member Ms. Finance.
Just one follow-up on that, sir. Could the Honorable Minister kindly say what is the allocation that goes to the purchase of bandwidth?
Honorable Minister.
Very well. In fact, sir, the honourable member might note, historically that line used to meet the cost of bandwidth, but we have, as of 2022, reclassified the bandwidth expenditure under telephone and internet charges. So if I might respectfully draw the honourable member's attention to line item 6271. The honourable member would observe that there is, in fact, an increase in that line, and that increase accounts for the internet bandwidth, which we thought would be more suitably classified under that line.
Thank you, sir.
Thank you, Minister, Honourable Member Ms. Finance.
Thank you, sir. The only reason I asked is because when the Honourable Minister was actually calling out what the order was for, you actually mentioned purchase of bandwidth, and I knew it was reallocated on another line item. That's why I asked, because you actually called it out when you were listing the order, purchase of bandwidth. That's why I asked. Nevertheless, sir, I think I'm done with this part.
Oh, very well, sir. I commend the honourable member for drawing my attention to this matter. In fact, what I have here is a tabulation, both of last year and of this year. So it's listed here, but you're absolutely correct. It's very, very astute of you to have noticed that it has been reclassified. Might I also, sir, avail myself of the opportunity to correct something that I said earlier. Might I, sir, I don't want to be on the record of saying something that was inaccurate. I said earlier that police and GDF have an allocation for overseas conferences. In fact, the GDF has an allocation for overseas conferences, not police. Police has an allocation out of which the cost of overseas training, I think, is met. It's under the training line. I wanted to clarify.
Thank you. Honourable Member Ms. Finance, you through? Honourable Member Ms. Foley.
Thank you very much, Mr. Chair, for acknowledging me. To the honourable member, if I can draw his attention to line item 6116. I noticed on the staffing details, you have an additional staff. You're increased by 1. Your staffing is increased by 1. And the proposed allocation for 2022 is some $451 million. Can you explain to us whether, one, it's a new opening? If yes, what is the designation of the person, where the person is assigned, and the emoluments? Thank you very much.
Honourable Minister.
Certainly, sir. So just to clarify that while the number increases by 1 from 82 to 83, while the number has increased by 1 from 82 to 83, it isn't that one person has been recruited. So there's been a net increase of 1. So some left and some came on. And the net impact of the ones that came on minus the ones that left is an increase of 1. And the reason why the expenditure increases by the amount that it has increased is because, in keeping with the established practice, when they came on in 2021 as new recruits, they were paid under the 6141, the other employment cost allocation. Thank you very much, sir.
Thank you very much, Honorable Minister. Honorable Member, Dr. Cummings.
Thank you, Mr. Chair. Mr. Chair, I was tempted to ask you to go to capital, but then I'm looking at capital and I'm wondering if it's under other. I haven't seen anything on the projects for the National Resource Fund. I mean, over this side, we're not against development. And as you said here, you want to strengthen, the legislative framework governing NRF, and some of the money will be transferred to the consolidated fund and so forth. But I mean, for others looking on and so on, I myself trying to give information, the National Resource Fund, where would those projects be? Or is it that when it's needed, as a project comes up, you take from, just enlighten us and give some information on the national risk, because none is identified here. So just enlighten the populace. Thank you.
Thank you, Honorable Member. Honorable Minister.
Sir, certainly, sir, gladly. The Honourable Member would recall, of course, that we brought a new, revised, revamped, and significantly strengthened Natural Resource Fund Bill to Parliament last year. And that bill addressed a number of the most, in fact, I would say, addressed the most egregious and offensive shortcomings of the previous Natural Resource Fund Act that was in place. Foremost amongst those is, of course, the foremost amongst those, sir, is in fact the measures that were designed to strengthen the extremely alarming, indeed some might say even vulgar weaknesses in governance as prescribed under the 2019 NRF Act, including, for example, the introduction of a board of directors where a board of directors did not exist previously, including a scaling back of ministerial powers as distinct from the extensive, intrusive, and excessive ministerial powers under the 2019 Act, etc. Critical amongst the provisions that needed to be addressed was the fact that under the 2019 legislation, a number of loopholes were left through which expenditure could be met from the fund, bypassing the parliamentary process and without appropriation. No, that's a fact. It is a fact that the NRF Act of 2019, it is a fact that the NRF Act of 2019 included provisions that would have allowed expenditure to be met directly from the fund, bypassing the appropriation process. That is a fact. The new NRF Act of 2021 ensures that all expenditure establishes a mechanism whereby transfers from the NRF Act come into the consolidated fund in their entirety and are then appropriated through the budgetary process. And so, sir, we would have spent the entirety of the last 4 days interrogating the budget that would have provided allocations for a variety of initiatives, national development priorities, and projects which would have benefited from scrutiny, by this National Assembly. And so the mechanism that is provided for in the NRF Act is one whereby withdrawals are made from the NRF fund, transferred to the consolidated fund, and then all forms part of the fungible pool of resources in the consolidated fund, and then national development priorities are appropriated through the budgetary process.
Thank you, Minister. Honorable Member, Ms. Finance.
Thank you very much, Mr. Chair. Just a follow-up on the response from the Honorable Minister on that. The Honorable Minister, and I just want to I believe the reason why my colleague asked the question is because throughout the interrogation of the estimates, we were being told that we have to ask the Minister of Finance which are the projects that will be utilizing the NRF amount. So could the Honorable Minister actually say how this House will know what specific projects will be utilizing the NRF fund, and also how that money will be audited?
Honorable Minister.
Sir, the NRF, the withdrawals from the NRF fund are deposited into the consolidated fund. National development priorities are determined through the budgetary process, of which the appropriation process is an integral part. The national budget is then subject to scrutiny during the course of its implementation and execution, and it is then subject to ex post auditing, sir, including, and of course, importantly, scrutiny by the Public Accounts Committee process, sir.
Thank you very much, Honorable Minister. Honorable Member, Ms. Fernandez.
Sir, I understand all of that, and as a member of the Public Accounts Committee, we were hoping that we would have had a very transparent system in which we will be able to track specifically the monies from the NRF funds and how it is being spent. This is the first time this fund is being utilized in a budget, sir. And the least we expect as members of the National Assembly, least we expect is to be able to tell the people of this country that this is what the fund was used for. Thank you, sir.
Honorable Minister.
I'm sorry, sir, I might have missed it. Was there a question hidden in there?
There was a remark, and if you so please, I'll ask you respond. If not, we can put the question.
I will reiterate, sir, that this government is committed to the highest level of transparency and accountability. And in fact, sir, over the course of the years, history will record it, sir, history will record it, that it is the People's Progressive Party, Civic, during our previous term of office, that had to restore the very important element of accountability that involves the production of audited financial statements. In fact, sir, history, it is now a fact of considerable notoriety that for the last 11 years that the People's National Congress was in office until 1992, not a single year of audited financial statements had been produced. In fact, sir, for 11 years, the people of Guyana were denied an opportunity to scrutinize financial statements documenting what was collected and what was expended by government. In fact, sir, the most cardinal and essential requirement of public accountability is audited financial statements. And for 11 years, a single set of financial statements had not been prepared, much less audited. And that, in fact, sir, is a fact that is widely documented. It was upon the assumption of office of the People's Progressive Party in 1992 that the practice of producing audited financial statements was reintroduced for the first time. And since then, sir, multiple steps have been taken to further strengthen accountability and transparency in public financial management, including a new and modern financial management legislation in the Fiscal Management and Accountability Act, a new Audit Act. Indeed, in fact, sir, the 2001 constitutional amendments includes a number of provisions spearheaded by the People's Progressive Party and shepherded through the constitutional reform process to enshrine stronger public accountability provisions in our constitutional architecture. These include, for example, an enhanced mandate for the Public Accounts Committee, removing from the Minister of Finance the role of submitting Auditor General's reports to the Parliament. In fact, it was widely felt, sir, prior to 1992, that the Ministry of Finance had been instrumental in frustrating the audit process. So the 2001 constitutional amendments ensured that the Auditor General's reports were going to be submitted directly to the Speaker and then tabled in Parliament. That has since been the practice since those 2001 amendments. And of course, very critically, sir, very critically, the 2001 Constitution also established special sectoral committees, including the Economic Services Committee, the Natural Resources Committee, the Social Services Committee.
Honorable Member Ms. Ferguson.
Thank you very much, Mr. Chair, for acknowledging me. I stand on a point of order. Standing order 40A. The honorable member asked the honorable member a question, and by right, he should provide a question rather than a political statement.
Honorable member, the honorable member Ms. Fernandez made a remark, and I offer the honorable minister an opportunity to respond. I'd actually also signal in it's time to wrap up, or I'll cut him off. I went like this. Honorable member, now with that intervention, I will have to put the remaining heads, the remaining programs, as we have exhausted the time. Honorable members, I now put a question that the sum stated for Agency 3, Ministry of Finance, Program 032, Public Financial Management Policies and Services Current Expenditure, and Program 032, Public Financial Management Policies and Services Capital Expenditure, stands part of the estimates. Those in favor say aye. Those against say no. The ayes have it. The sums stated now stand part of the estimates. Let me take this opportunity to thank the Honorable Minister and his staff for taking us through his agency.
Permit me, sir, similarly to thank you, sir, and all of the colleagues who posed questions and gave me an opportunity to elaborate, and of course, reiterate my own thanks to my own team. Thank you very much, sir.
Thank you very, very much, Honorable Member and team. Honorable members, this completes consideration by the Committee of Supply of the estimates of expenditure for the year 2022. The Assembly will now resume. You may have to say all the maces. Honorable Minister of Finance.
Thank you very much, sir. Thank you very much, sir. I have to report, I believe I'm at the point where it is my duty, sir, to report that the Committee of Supply has considered the estimates of expenditure for the financial year 2022 and has approved of those estimates as printed, sir.
Thank you, Honorable Minister. I will now put the motion, which is that this National Assembly approves the estimate of expenditure for financial year 2022 of the total sum of $501,678,298,000, excluding $51,255,000 and $420,000, which is chargeable by law as detailed therein and summarized in Schedule 1, and agree that it is expedient to amend the law to make provision in respect of finance. The recommended lump sum subvention for each constitutional agency for the financial year 2022, as stated in Schedule 2, amounting to the total sum of $11,729,840,000, which is charged upon the consolidated fund by the Constitution, and for the sums voted for the constitutional agencies to form part of the estimate of the revenue and expenditures of Guyana for the financial year 2022. The sum of $126,694,310,000, equivalent to US $607,646,570.98, to be withdrawn from the Natural Resource Fund for the financial year 2022 in accordance with the Natural Resource Fund Act 2021. Those in favor say aye.
Aye.
Those against say no. The ayes have it. The motion is carried. Honorable members, we will now deal next with the appropriation bill. We have to deal with the suspension of standing orders numbers 13N and 54. Honorable Prime Minister.
Mr. Speaker, with your leave, I move that standing orders numbers 13N and 54 be suspended to enable the Appropriation Bill 2022, Bill number 1 of 2022, to be introduced at this stage.
The question is that standing orders number 13N and 54 be suspended. Those in favor say aye. Those against say no. The ayes have it. The motion is carried. Honorable Minister of Finance.
Thank you very much, Mr. Speaker. In accordance with paragraph 2 of Article 171 of the Constitution, I signify that the Cabinet has recommended that the Appropriation Bill, Bill number 1 of 2022, be considered by the National Assembly, and I now present the bill to the Assembly and move that it be read the first time. Thank you very much.
Thank you, Minister. The question is that the Appropriation Bill 2022, Bill number 1 of 2022, be read the first time. Those in favor say aye. Those against say no. The ayes have it. The motion is carried. Let the bill be read the first time.
Appropriation Bill 2022, Bill number 1 of 2022.
Honorable Minister of Finance.
Thank you very much, sir. I now move that the Appropriation Bill 2022, Bill number 1 of 2022 be read a second time.
Honorable members, the question is that the Appropriation Bill 2022, Bill number 1 of 2022, be read a second time. Those in favor say aye. Those against say no. The ayes have it. The motion is carried. Let the bill be read a second time.
Appropriation Bill 2022, Bill number 1 of 2022.
Honorable Minister of Finance.
Thank you very much, sir. And I now move that the Appropriation Bill 2022, Bill number 1 of 2022, be read the third time and be passed as printed.
Honorable members, the question is that the Appropriation Bill 2022, Bill number 1 of 2022, be read the third time and passed as printed. Those in favor say aye. Those against say no. The ayes have it. The motion is carried. Let the bill be read a third time.
Appropriation Bill 2022, Bill number 1 of 2022.
Honorable members, we now have this, shut up, public buildings, business. Honorable members, we now have the second reading of the Fiscal Enactment Amendment Bill 2022, Bill number 2 of 2022, published on the 4th of February 2022. Honorable members, we will now proceed with the second reading of this bill, the Fiscal Enactments Amendment Bill 2022, Bill number 2 of 2022, published on 2022, February 4th. Honorable Senior Minister in the Office of the President with responsibility for finance.
Thank you very much, sir. It is, in fact, sir, not my intention to speak at great length in relation to this bill, because we have, of course, been considering during the course of the budget debate, and indeed throughout the course of the budget debate, we have, in fact, been considering and discussing various elements captured in the bill. The bill, sir, is intended, this is, of course, the Fiscal Enactments Amendment Bill, is intended to amend the legislation, the relevant tax statutes, hence it's being intituled Fiscal Enactments Amendment Bill. The bill is intended to amend the various tax statutes that require amendment for the purposes of giving effect of the measures included in Budget 2022. It would be recalled, for example, sir, that there are provisions in the bill, there are provisions rather in Budget 2022 that are intended, for example, to increase the income tax threshold. That measure was announced in the context of Budget 2022. It was, of course, I believe, adequately and abundantly ventilated during the course of the debate on the budget. This bill now seeks to give legislative effect to that announcement. It similarly, sir, the bill similarly, sir, seeks to give effect to other tax measures announced during the course of Budget 2022. To give you a second example, we announced, for example, the removal of the withholding tax from persons earning interest income not exceeding $10,000 per annum, intending to give relief to persons with deposits below a certain threshold or earning interest income below a certain threshold. This bill seeks to give effect to that provision. Other provisions that are addressed by this bill include, importantly, sir, the provision that provides relief for insurance premiums that are paid. It would be recalled similarly that the budget announced that we will be providing tax relief to persons paying for life and medical insurance up to a specified threshold. This bill seeks to give effect to that announcement. So, sir, it is not my intention, like I said at the beginning, it's certainly not at this stage my intention to address this in any significant or protracted manner, because I believe these issues were abundantly addressed and ventilated during the course of the budget debate. Depending, sir, on the observations made by my colleagues on that side, I will return at the conclusion of this matter to address any issues or questions raised. With that, sir, I move that the bill, or I will move at the appropriate time that the bill be read. I think it would be a second time and be passed as printed. Thank you very much, sir.
Thank you, Honorable Minister. Honorable members, any contribution? Honorable Member, Mr. Ramjatan.
Yeah, I just want to say that obviously it's a consequential, a bill that comes as a consequence of the Appropriation Act and the motion for the budget being passed. Of course, during the course of the debate, we did criticize a number of the issues, like the threshold to get higher And of course, so we restated by virtue of this brief remark that we have done our criticism of it during the course of the budget debate. But they have the majority, Mr. Speaker. And so you would have to put the question, I suppose.
Thank you, honorable members. Honorable member, I put Honorable Minister of Finance.
Thank you very much, sir. So I believe it's my duty now to move that the bill be read the second time, and I so do.
Honorable members, the question is that the Fiscal Enactments Amendment Bill 2022, Bill number 2 of 2022, published on the 4th of February 2022, be read a second time. Those in favor say aye. Those against say no. Ayes have it. Let the bill be read a second time.
Fiscal Enactment Amendment Bill 2022, Bill number 2 of 2022.
Honorable members, we will now resolve ourselves into committee to consider the clauses of the bill. Honorable members, the bill has 2 clauses and 1 schedule. And I will put all of them. I propose the question that that clauses 1 and 2 and the schedule stand part of the bill. I now put the question that clauses 1 and 2 and the schedule stands part of the bill. Those in favor say aye. Those against say no. The ayes have it. I now put a question that the bill as printed be reported to the Assembly. Those in favor say aye. Those against say no. The ayes have it. Let the Assembly resume. Honorable Minister of Senior Minister in the Office of the President with responsibility for finance.
Thank you very much, sir. I will. It is most. I feel it's my duty, sir, to express great regret that our friends on that side of the House saw it fit to oppose these measures that are intended to benefit the people of Guyana. Be that as it may, sir. Be that as it may, sir. We on this side of the House are pleased to report that notwithstanding the objections of our friends on that side of the House, the Fiscal Enactments Amendment Bill 2022, Bill number 2 of 2022, was considered in committee, clause by clause, and was passed without amendment. And I now, sir, move that the bill be read the third time and be passed as printed.
Honorable members, the question is that the bill be read a third time and passed as printed. Those in favor say aye. Those against say no. The ayes have it. Let the bill be read a third time.
Fiscal Enactments Amendment Bill 2022, Bill number 2 of 2022.
Thank you very much. Honorable members, we have one piece of tidying up to do. The honorable member, Mr. Ramjatan, did raise an issue this morning with respect to the suspension of the honorable member, Mr. Duncan, being done in committee. I now call on the Honorable Minister Teixeira to move the motion formally in the Assembly.
Whereas yesterday, during the consideration of the estimates of expenditure in the Committee of Supply, a member, Mr. Sherrod Duncan, MP, displayed gross disorder and disregarded the authority of the chair. And whereas the said member was named by the chair of the committee of the whole House, and whereas a motion was moved and agreed to that such a motion, and whereas a motion was moved and agreed to that the member, Mr. Duncan, be suspended from the service of the House, and whereas the standing orders require that such a motion be made in the Assembly and not in committee, and whereas a motion is now placed before the Assembly as required by Standing Order number 47, subclause 3, subclause B, be it resolved that the member, Mr. Sherrod Duncan, MP, be suspended from the service of the Assembly for 4 consecutive sittings. Thank you, sir.
Honorable members, the motion is proposed. Those in favor say aye. Those against say no. Ayes have it. The motion is proposed. The day started from today. Thank you. Honorable Prime Minister, honorable members, this concludes our business for today. Honorable Prime Minister.
Yeah. Mr. Speaker, on behalf of the members of Parliament on this side of the House, I would like to take the opportunity to thank you for the manner in which you conducted the business of the House. It successfully brought us to this point, the conclusion of the business of the House pertaining to the passage of the budget for 2022. Thank you and your staff for the work over the past 2 weeks, Speaker. Mr. Speaker, I now move the adjournment of the Assembly to a date to be fixed.
Honorable members, let me join the Honorable Prime Minister in thanking all members of the House, our staff, all the support staff, services, security, mails, our support staff from the different agencies and ministries, media, for also their contributions to the successful completion of the 2022 budget. Honorable members, the House stands adjourned.